psychological problems, addictions, peer pressure is there, social media influence is there, sleep problem, menstrual disturbances may be there, and study related, particularly when they are, you know, appearing for the board exams, like in the 10th, 11th, 12th, like that. So we need to do like that. So every adolescent child, I recommend Shirodhara for them in every 6 months. This is as a prevention for anything else. Pandu is also one of the very common. And एक केस मेरे पास आया था, referred, you know, that child is 7-year-old female. उसको पाल्पिटेशंस होती है, घबराहट होती है, जैसे कुछ चीजें लेती है या उसकी पोजीशन चेंज होती है, ऑल ऑफ अ सडन अगर वो भागती है, ऐसा कुछ होता है तो उसको पाल्पिटेशंस था. उस केस को मेरे पास लेकर आए थे, एंड उससे पहले उनको एक जनरल फिजिशियन के पास लेके गए थे पाल्पिटेशन. तो दैट जनरल फिजिशियन हैज रिफर्ड हिम टू, यू नो, ए न्यूरोलॉजिस्ट, एंड न्यूरोलॉजिस्ट उनको देके एक कोई मेडिसिन उनको रखा है, एंड देन ही रिफर्ड टू साइकोलॉजिस्ट की शायद स्कूल में कोई दिक्कत हो सकती है. स्कूल का फिर उनके टीचर्स के साथ मिले, ये सब हुआ. उसके बाद साइकोलॉजिस्ट की एक मेडिसिन, न्यूरोलॉजिस्ट की एक मेडिसिन को लेते हुए मेरे पास आया कि लेट अस ट्राई फॉर एन आयुर्वेदिक आल्सो. सो मैंने उसको देखा, देखने के बाद मुझे ऐसा कुछ लगा कि पूरा एग्जामिन करने के बाद उसको रसधातु क्षय भी लक्षण लग रहे थे और रक्त धातु क्षय के भी लक्षण लग रहे थे. मैंने सिंपल सीबीपी करवाया. सीबीपी करवाने के बाद उसको आया 6.5 ग्राम्स. एंड आई वाज शॉक्ड कि आप इतने सारे डॉक्टर्स के पास गए, आपको कोई हीमोग्लोबिन नहीं करवाया? नहीं, हमने प्रॉब्लम बताया, फिर सारा उन्होंने पूछा, फिर देन उनको मेडिसिन दिया. तो मैं धीरे धीरे उनकी 1 हफ्ते में उनको टैपरिंग करके उस मेडिसिन को स्टॉप करवाया. एंड देन आई स्टार्टेड सिंपल विद दात्री लो, नॉट विथ वेरी वेरी मेजर. दात्री लो मैंने दिया, देन भृंगराज आसन दिया. एंड उसके बाद उसका आप यू नो, यू कैन नॉट बिलीव दैट 40 डेज के बाद जो है उसका वो चीजें मतलब सारे बंद हो गए थे. दिस इज हाउ सिंपल. कभी कभार ऐसा लगता है कि दिस आर नॉट अ बिगर इश्यू, बट हमें लगता है ऐसा. हेलो, मैं बाद में करती हूँ, sorry. And next, dentition problems. So dentition problems, like you know, you all know, उसमें dentition में दंतोद्भेदक दांतक रस देते हैं. एंड इसके अलावा पिप्पली, पिप्पली हम सिंपल पिप्पली भी आप दे सकते हो. इलायची को पाउडर करके शहद के साथ चटा के गम्स में आप लगा सकते हैं टू ईज एंड रिलीव पेन. तो कपूर इज वेरी वेरी इफेक्टिव इन एज ए पेन किलर. हम डायरेक्ट ना देके उसकी माला बना के उसकी माला को जो है हम गले में टांग दे तो वो भी इफेक्टिव रहेगा. नहीं तो कपूर तेल तो है ही है, लवंगादी तेल आती है ना, तो गार्गलिंग भी हम करवा सकते हैं अगर वो बच्चे 5 इयर्स के ऊपर हैं या 4 साल के ऊपर हो. तो नहीं होगा, छोटे बच्चे हो तो सिर्फ हमें अप्लाई करना होगा. शूल इज ऑल्सो अगेन यू नो वेरी बिग टॉपिक. इट इज जस्ट वी हैव टू सी कि क्या ये पित्तज शूल है कि बहुत मतलब इंफ्लेमेटरी टाइप है कि टच भी नहीं कर पा रहे, देन वी हैव टू रिफर दैट. अदरवाइज यू नो वी कैन मैनेज दैट ऑल्सो. समटाइम्स यू नो मे बी अपेंडिसाइटिस हो सकता है अगर लोकलाइज्ड पेन है और ट्रिगर हो रहा है. पेन कहाँ है, साइट वगैरह देखते हुए हमें देखना होगा. वरना इन शूल में लेप डू वंडर्स. अच्छी लेप्स, अगर हम कफज है तो थोड़ा थिक लेप लगाना है, वातज होगा तो थोड़ा पतला विथ यू नो कोई ऑयल के साथ मिक्स करके हम लगाएं, और पित्तज होगा तो कोई कषाय वाला अगर साथ में हम लगाते हैं और साथ साथ में हम इन्फेक्शन और इमरजेंसी को रूल आउट करें तो इट डू वंडर्स. प्लानिंग द ट्रीटमेंट, एज यू नो दैट कुछ भी हम प्लान करेंगे तो दीपन पाचन औषधियों से शुरू करते हैं. अगर कोई ऑब्स्ट्रक्शन है वॉट एवर इट इज मे बी, तो उसको हम स्रोतोशोधन देंगे, देन ओनली गिव फॉर ब्रह्मणा. नॉट कि एवरी चाइल्ड इज कमिंग वीक अगर हो गया तो मल्टीविटामिन डोंट स्टार्ट इन द फर्स्ट विजिट. आप मल्टीविटामिन नहीं स्टार्ट करना है. वंस यू हैव टू गिव दीपन पाचन, देन स्रोतोशोधन, देन फॉलोड बाय रसायन एंड ब्रह्मण. एंड सिंगल हर्ब्स आर वेरी वेरी एसेंशियल व्हेन इट कम्स टू यंग चिल्ड्रन. जहां न्यूनेट्स हैं, जहां मंथली बेबीज हैं, वहां मैं कहती हूँ कि एक यू नो जाति फल रख लो, आप हरितकी रख लो. इस तरह से सिंगल हर्ब्स को मैं बताती हूँ. हल्दी, कच्ची हल्दी रख, तो इस तरह से उनको घिस के बस देते रहना चाहिए. एंड सौंफ का पानी, these all do wonders, you know. These are the rasayana drugs specific to the specific tissues, so we can pick whatever as per their adaptability, as per their you know taste palatability. We can choose anything of that. And age wise, Age-wise suitable Rasayana herbs are there. These I have been taken from the Arogya Raksha Kalpadruma. It's an exclusive book for the pediatric practice. It's a very good book. So one can give this as a preventive medicine. Now it comes like when to give, Panchakarma, when we have to give Panchakarma. So Panchakarma, when the problem is chronic, बहुत लंबा समय तक मेडिसिन ले लेके बच्चा थक गया है, वहां that is an indication for Panchakarma. And if the problem is suppressing and again after 15 or 1 month or after 2 months, if it is recurrency में हमें देना होगा. Not responding to any pathy, whether it is allopathy, homeopathy, ayurveda, anything. If it is not responding, go for Panchakarma. And if we can't give medicines for longer time also, there we have to go for Panchakarma. So Panchakarma means not only the classical Panchakarma, there are many sub procedures and miscellaneous procedures are there, which are very, very much helpful for the children. And during the Panchakarma, there are quite challenges which we used to come across. One thing is, if we tell them कि हमें अगर हृदवस्ती करनी है, कि congenital, heart disease है, वहां पे हम साथ में हृदवस्ती करना है, तो we need to counsel them more, कि हमें पहले उनको आश्वासन देना होगा. वो फिर कहेंगे 100% ठीक हो जाएगा. Then I'll ask them कि आप जितने भी डॉक्टर्स के पास गए होंगे पहले, तो क्या उस डॉक्टर से यही बात आपने पूछा है 100% ठीक होगा? Why फिर asking the Ayurvedic doctor with high expectations? Then skills to encounter the adverse reactions is very, very important. कि अचानक अगर कोई वस्ती हमने दिया, उसको इतना वस्ती के साथ साथ में वस्ती द्रव्य के साथ साथ इतनी वाटर लॉस हुआ, ऑल ऑफ ए सडन वो इट्स गोइंग इनटू सेमी कॉन्शियस उसमें जाएगा, तो हमें उस चीज को काउंटर करने की स्किल्स आते हैं कि नहीं, दैट वी नीड टू. सो व्यापत्त को हमें अच्छे से पढ़ना है और उसकी रिलेटेड वाले सारे हम रखना है अपने पास, देन ओनली हैव टू गिव. First aid techniques are very, very important. One need to know how to resuscitate. One need to know how to, अगर burns है तो कैसे करना है, तो अगर फ्रैक्चर हो रही तो कैसे, इन चीजों को भी हमें साथ में लेके तभी पंचकर्मा हमें करना होगा. Ask for many important things. Ask for allergies. Even though the Yashtimadu is very sheath and very congenial, but sometimes I have seen a very rare case where even the slight application of the Yashtimadu also causing rashes, skin rashes. So we cannot, think that it is a very safe. Patch test is very, very important before applying any lepa. This I could not able to, collect more. I have many cases with, pre and post, but I could not able to. This is a case with, severe bronchial asthma case. Every month used to affect, and you see the changes related to the deviation in the, chest, this pectoral girdle and all. So there we given, Tekaraja Tail and Karpura Tail mixed Urovasti for 15 days continuously. And that recurrency has decreased a lot. And after that, we are given other therapies, Sarvangadara and all. This is a case of Earth's palsy, where the child is, delivered normally, but it is with the help of forceps. At that time, on the same day, they have not recognized and they get discharged in the second day. And after coming to the home, they have seen that they are not, the child is not using the one of our this left hand. So immediately, because they are the known, for me, so they have sent me the pic of this. After seeing only, I told that you just bring it to me. Then after, I have started giving some, oils, and also I've started Swarnaprashan, and it told some exercises related to that and the Abhyanga techniques and all. So in between the treatment, only after 15 days, the hand, could able to abduct a few. And this is after 2 months, the child could able to, fully move her shoulder joint. And now the she is of 4 months. Her grip is slightly less. Otherwise, we cannot say that she's suffered with Erb's palsy. Shiropichu is also much, much important. Until and unless the anterior fontanelle is not closed, daily regular Shiropichu I advised for the children according to their prakriti and the need for that. So conclusion, I hope I have taken much time. Sorry for that. Conclusion is identify the health risk behavior in childhood and prevent the formation of risk factor. right drug, right dose, right time, and right anupana will hit the pathogenesis and it will give right results. So Sukham Dukkam hi balanam lehet kanakam shishum. So Swarna Prashan, please do follow that with regular, not only that one single day, but daily regular practice is very important. Thank you so much for patient hearing.
Thank you so much, ma'am, for such an informative lecture. I would like to request Pritlani sir, please conduct the question answer session.
Yes, good afternoon, everyone. Thanks to the Ayurveda Teachers Association office bearers, especially our friend Dr. Mundal Chaudhary sir, for giving me this opportunity to be a part of this academic fest. Madam has, Dr. Snehalata madam has precisely covered most of the common problems, pediatric problems and their Ayurvedic management. She has also covered the new problems of the children, that is the screen time, increased screen time and attention deficit hyperactivity disorders. There is one question from Dr. Amar Kamble sir. Madam, he wants to know your views regarding Ayurvedic management of malnutrition.
Thank you, sir. Thank you, Lalit sir. Ayurvedic management of malnutrition, again, the plan for this treatment again depends on the age, mainly the age. At what age the malnutrition occurred? Suppose in the 1 year or 2 years only the malnutrition is there, means malnutrition means what? Age inappropriate with all the anthropometrical measurements. So we cannot tag exactly as if we know that the reason is because of malnutrition, then only we can tag it as a malnutrition. Otherwise, with all the low anthropometrical measurements, we cannot tag it as a malnutrition. Maybe sometime malabsorption may be one of the symptom, or sandarpana janya vyadhi, overnutrition also may leads to malnutrition and all. But if we know that it is because of malnutrition, the simple thing is we have to rectify the proper nutrition. That's it. If the age is 2 years, according to the age 2 years, what has to be taken, that we have to give. See how much of the quantity of what food to be taken, like usual preparations can be taken, and all the protein related, herbal protein related diet can be taken, and vastis can also be planned once the agni gets enhanced. And then think for the rasa dhatu, rakta dhatu, then like that, all the dhatus to be taken into consideration and be nourished according to their agni, bala and ojas.
Thank you, madam. Madam, in the starting of the lecture, you have emphasized on application of the head oil, and in the end of the lecture, you have also told about the Shiropichu and its importance. We want to know in which type of Prakriti person, that is Vata Pradhan, Pitta Pradhan and Kapha Pradhana, which oil is best to use?
Sir, see, before answering your question, I just want to share one of my case also. Yes, as we see in the newborn babies or in the neonates, we see the physiological jaundice or sometimes pathological jaundice where the bilirubin levels goes higher levels. So at that time, just after crossing of this 15 gram per DL, they shift to phototherapy and all like that. So what I used to do is, before starting that physiological, as we know that 60% of the patients, they used to have that. So initially, once in the second day or the third day only, if I could able to see the changes in the yellowish discoloration and all like that, then the clean, hygienely prepared Bhrungaraj Swarasa Pichu will be applied on that, on the Shiros. I have done it in many cases where there was not any necessary for the children to keep in the phototherapy. By that, the child's that consequences related to that extra over use of this phototherapy also gets decreased. And in the same way, Balatela Pichu already Acharyas has told. So Balatela Pichu can be taken for the children. And if Pitta Prakriti is there, Himasagara Taila is there. So hundreds of tailas are there with different combinations. Brahmi taila is there, Brahmi Lakshadi taila is there, Lakshadi Kera tailam is there. There are different combinations, like, you know, one tail is prepared with a base of Kera tailam, that is coconut, and the other is prepared with the sesame tail. If coconut tail preparations are taken, then they are very congenial to the children. So Eladi Kera tailam or Lakshadi Kera tailam, Himasagara tailam, all these will helpful in children in a very good way.
Okay.
Manjishtadi tailam can also be taken when the children are suffering with, you know, some what you say, pratishaya and all these things. Vatahara, Kafahara, Aushadis can also be taken into consideration, where in which the tailas are there, the Dashamula taila is there, Rasana is there, so that can also be taken. Panchasneham can be taken, sir, in the malnutrition cases also. Panchasneham tail is there. It is a mixture of, you know, all the tails. Even in the rickets or, you know, in the delayed anterior fontanelle closure, there also it acts. Mahamasha tail is there. Masha Saindavadi tail is also there, where if you want Stroto Shodhan if you want, then Masha Saindavadi tail can also be taken. And Neeli Brungamala Kyadi tail. This is also when you want to nourish the sense organs, especially in the autistic children or ADHD, there Brungamala Kyadi Kera tailam. It can be taken. And there is a Dasha Pushpa tail. That tail is prepared with, you know, all the 10 flowers. This is not easily available everywhere. So that is also is very good in, you know, all these neurobehavioral developmental diseases. And sometimes, you know, not only the tail, we can blend the tail with the ghee. So I have introduced research Grita Shirodhara. Grita Shirodhara earlier in 15 years back only, for the cerebral palsy and the neurobehavioral developmental disorders, where I used to give only exclusive Gruta Dhara, Shirodhara. So we can do Chiro Pichu with Taila and Gruta also. Brahmi tail is there, Ashwagandha tail is there, ghee is there. Sorry, in ghee. Mahakalyanak is very, very good in this. It depends on the condition one can give.
Okay, thank you, madam. As someone has precisely said, education is nothing but the facilitated process of conditioning the mind. And ATA is sincerely doing this in a precise way by guiding the new generation of Ayurvedic teachers, that is, teachers, a nation builder. Madam, moving towards the next question is from Dr. Ajit Metke, sir. He wants to know the Ayurvedic approach for multi-drug resistance pneumonia.
So multi-drug
resistance pneumonia. Nowadays, a very common problem in the pediatric field.
Yes, sir. If a case is coming with multiple resistant pneumonia, so it means that already had taken multiple antibiotics at a previous time. So already low immunity. First thing we have to check whether the birth history tells us a premature baby or low birth weight baby. If they are with, then we have to educate the children. There is something, these are the problems, struggling problems which occurs. Urodhara with different angles, like prone positions, side positions, and the back positions and all, followed by Urovasti, because we cannot give again the medicines here. If you want, we can give the medicines which are having, you know, Swarna, Abhrak, Loha, Gopi Chindanadi Gulika, and combination with the Swarnaprashan, like that, only single medicines, that's it. And Karpura tail, Tekaraja tail, bronchodilators वाले कुछ ऑयल्स के साथ हम उरोधारा हमें करना हो. नॉट इन द एक्यूट कंडीशन टाइम में, उस टाइम में नहीं करना है. जैसे ही एक्यूट कंडीशन ठीक होके जब वो, उसके बाद फिर हमें देना होगा. उसके बाद हम लेप लगा सकते हैं सर, थिक लेप हम लगाए, बिकॉज द सबक्यूटेनियस द स्किन ऑफ बेबी इज very thinner when compared to the adults and the absorption is more. So उस समय में हमें लेप लगाना है ताकि नीचे की जो लोअर रेस्पिरेटरी ट्रैक्ट तक हमें पहुंचने के लिए एज सच आयुर्वेद में कुछ नहीं है. तो the best route is subcutaneous route.
Okay.
So
Thank you,
इस
madam.
रूट को लेके हमें तेल और वो लेना होगा.
Thank you, madam. As we all know that data is the new currency in the field of technology. Similarly, the evidence is the currency in the field of science. And I sincerely hope that through this presentation and discussion afterwards, all of us will get benefited for our practice. It looks like we are running out of time. So I guess I have to finish here. For further proceedings, I hand over my mic to the Dr. Manisha madam. Thank you.
Thank you, sir. I would like to request Dr. Kamath ma'am. Ma'am, please give your expert opinion on this session.
Good afternoon, everyone. First of all, I must thank ATA for giving me the opportunity to chair this session. It was a very fruitful session. Dr. Dornala madam elaborately presented all the issues and problems which are faced by pediatricians nowadays. The topic is so vast that I think she was in paucity of time actually, but she tried to cover a lot of problems and issues which are faced by the pediatricians. So I would just like to comment slightly that nowadays the issues faced by the pediatricians are of two types, essentially that the causes, the diseases which are seen in the pediatric age group are generally of two types: excess and where there is lack of nutrition. This is a very common problem nowadays because of lack of movement, especially within the last 2 years due to corona and other such things. Children are sitting around in the house doing nothing, and the first 3-4 slides madam had shown the postural changes which are occurring earlier in the children because of excessive use of gadgets. That is very commonly seen, and because we have to, whether we like it or not, as parents we have to provide the gadgets because of the schools. So if we have to do such things, then the most important thing which I feel is the parents should be taken into trust when we treat the children. That is a very important thing as pediatricians, that first the parents should be able to trust the pediatrician, and that is a very big issue because nowadays parents are well educated, they are googling all sorts of things, and that's why they have to be taken into trust first, and then only we can tell them about whatever treatment we can do. Like excessive diseases of excesses, that is many times we are seeing now that the children are obese in affluent families. That is because they are getting all things as soon as they ask for it. And this is going to happen. We have to face it. But then whatever, like one case I can remember, just an example without taking much time. That is a patient had come and she said that my child does not eat anything unless and until I give her a 5 rupee noodle packet. 5 rupee noodle packet. So how in the first place get addicted to that noodle packet? Because the mother used to give it to her because it was very easy to prepare. So when we tell the parents not to give them oily food or any other such thing, we have to also provide them with alternatives. That is, chips or any other such things. Then what they can give otherwise, that is also very important as far as prevention and nutrition is concerned. Like for a simple example is, many patients of mine remember me because I tell them usually that if you want to give a quick fix to the child, like noodles, instead of that, you can always give the child a peanut laddu, which with things that are easily available around the house. That is what is needed is only peanut jaggery and ghee. So that is easily available in the house. So such alternatives are needed to be provided to the parents when you tell them not to give whatever, oily food and all such things. And children should be encouraged to play outside. That is very important, which or play, that is physically play, which is likely to reduce many ailments which are seen in the children nowadays. Now, without taking much more time, because there is a lot one can speak on these issues, still, since we are in lack of time, one thing I would like to add that when I was introduced, thank you for the introduction, sir, Raut sir. The only grudge is that he made me feel old. So anyway, so as a senior person, I just added some few things from my experience, like peanut laddu and so on. So thank you, sir. And thank you, ATA, for giving me this opportunity to speak at this session. Thank you very much.
Thank you, ma'am. I deem it a great honor and privilege to propose the vote of thanks on behalf of the organizing committee of ATACON 4th National Conference 2022. We are extremely thankful to Dr. Professor Snehalata Dornala ma'am for giving an excellent coverage to pediatric problem and their solutions. I like to express my sincere thanks to Dr. Anjali Kamath ma'am. Thank you, ma'am, for giving your valuable time to us. We are extremely happy with our co-chairman, Dr. Mohan Raut sir and Dr. Vitlani sir. Sir, thank you so much for joining us. I would like to put on record our healthy thanks to Dr. Sonia ma'am and Dr. Amar Kamre sir for the perfect support and guidance. Finally, I also extend my thanks to all the participants and back office team. Now I conclude that the session is over. I hand over the commands to Dr. Sonia ma'am and Dr. Kamre sir. Thank you, all of you.
Thank you, Manisha madam.
Thank you.
Thank you, madam.
First of all, thank you, Dr. Snehalata Dornala madam. She has put the light on various Hetu Sevan, that is Ahitkar Ahar Vihar Sevan, which is seen frequently in this modern era, and which is giving rise to the various diseases, various unnamed diseases, rather to say, in children's. And thanks, madam, for your very experienced and knowledge lecture on various pediatric diseases. We will be definitely get benefited with that. And also thank for giving various references which go unrecognized while reading the Samhitas. I thank to Dr. Anjali Kamath madam, chairperson,
Thank you.
for giving her opinion. I also thank Dr. Mohan Raut sir for conducting the session very nicely. I also thank Dr. Vitalani sir for conducting the question and answer session very nicely. And at the end, I thank Dr. Ajit Metke sir and Dr. Dr. Manisha Jagtap madam for successfully conducting this session. And thanks to one and all. So we are ending the session here. So moving further to the next session, which is 4th session, I would like to introduce our session coordinator, Dr. Madhulika Tiwari madam. She is the session coordinator for the 4th session. Madhulika Tiwari madam is working as an associate professor in a department of the Rachna Sharir in Datta Meghe Ayurvedic Medical College and Hospital, Nagpur. She is pursuing PhD in Rachna Sharir subject. She has presented 4 papers in international peer-reviewed journals. She has been indulged in the various research activities. She has 5 granted copyrights and she has 4 papers presented and overall 19 research articles published in the international journal. Among them, 5 are published in the Scopus Index journals. So I request Dr. Madhulika Tiwari madam to conduct this session. Dr. Madhulika madam, over to you.
Good afternoon, sir. Thank you, Amar sir, for inviting me for this session. And I welcome you all in today's Ayurveda Teachers Association organized 4th National Conference on Evidence-Based Ayurveda. I welcome you all for this session, and I would like to introduce, we have very eminent speaker among us. We have eminent chairperson, co-chair for this session. I would like to introduce them to you. I welcome you. We have amongst us very renowned proficient researcher, Dr. K.M. Pratap Shankar sir from Thrissur for today's session as a speaker. We have chairperson, Dr. Sudhir Kandekar sir for today's session of research trends and prospects of Marma Chikitsa. Also, we have amongst us as a co-chairperson, Dr. Sachin Khedikar sir who will be heading the co-chair today. First, I would like to just give a brief introduction of our today's chairperson, Dr. Sudhir Khandekar sir. It is my pleasure to introduce today's chairperson, Dr. Sudhir Khandekar sir. He is a BMS MD in Rachna Sharir. Sir is presently working as a professor and head of department at Radhakrishnan Doshniwal Ayurveda Mahavidyalaya, Akola. Sir has formerly held the post of head of department at MGAC, SRC, MGAC Salod Vardha, SRC Ayurveda College Chikhli. Sir has also held the post of vice dean at MGAC Salod Vardha, and he has been an officiating principal at SRC Ayurveda College Chikhli. Looking at his research profile, sir has a very good profile. Sir has completed more than 12 research projects. He is having currently 5 research projects in hand, and also published more than 15 articles in peer-reviewed international journals. Sir is a founder. I'm very proud to say that sir is founder of spine and Marma remediation techniques. He has been applying Marma Chikitsa since last 15 years, and he has established a result-oriented methodology to overcome ailments affecting to the sufferers. And thousands of patients, not only from our country but abroad, have been benefited with sir's treatment. Sir is a proud recipient of Best Teachers Awards consecutively in 2010, 11 and 12. Sir has held various university responsibilities as a member of Board of Management at DMIMS in 2011 and 12. He has been member of Academic Council at DMIMS DU in 2012 to 2014. Sir has been member of Board of Studies Preclinical Board from 2006 to 2014. Sir has also been a member of Examination Cell at DMIMS DU in 2006 to 2014. This way, sir has held various responsibilities at various posts, and he has been working in the field of Marma Chikitsa since long, and it is a pleasure to have him amongst us. Thank you, and I welcome you, sir.
Thank you, madam. Thank you.
We have the co-chairperson for our today's session. I welcome Dr. Sachin Khedikar sir for today's session. I'll give a brief introduction of sir. We already know sir is a great personality in the field of Ayurveda. Sir is BMS MD in the subject of Rachna Sharir. Sir is presently a PhD scholar at MGAC Salod Vardha. Sir is currently working as a Dean Academics, Professor and Head of Department Rachna Sharir at Sri Sai Institute of Ayurveda Research Medicine, Bhopal. Sir has previously held the post of Principal at Sri O.H. Nazar Ayurveda College, Surat. Sir has a vast teaching experience of 14 years, which includes 7 years of PG teaching experience. Dr. Khedikar sir has published 2 patents in the field of Ayurveda. He has published more than 30 research papers in international peer-reviewed journals. Sir is also proud recipient of more than 10 awards till date. He has presented more than 30 research papers in international and national and international seminars and conferences. I'm proud to say that sir has graced various national and international conferences as chairperson. He has also been a resource person at an ROTP for Rachna Sharir. Sir has contributed around 3 chapters in proceedings in the conferences. Also currently, one of the book on research methodology is in the way of publication. And I welcome, this is a very short biodata of sir. I know we can add a lot to this. I welcome you, sir. Dr. Sachin Khedikar, sir. Welcome to this conference.
Thank you, ma'am.
Thank you, sir. I would request sir to kindly introduce our today's speaker, Dr. K.M. Pratap Shankar, sir. Over to you, Sachin, sir.
Thank you, madam. Today's eminent speaker is Dr. K.M. Pratap Shankar, sir. He has completed his BMS from Dharma Ayurveda Medical College, Tamil Nadu and he has completed his post-graduation, that is MS Shalyatantra, from SV Ayurvedic College, Tirupati. And the title of his thesis was about leech application in Vicharchika. Then presently he is working as a research officer in National Ayurveda Research Institute for Panchkarma, Cherutu Ruti, and in CCRS, Ministry of Ayush. His professional experience is he was worked as an assistant professor in Department of Shalyatantra in Santgiri Ayurveda College, Palakkad, between 2013 to 16. He has lot of publications in his credit. Recently, he has published a book. Content development for the book was, that is Marma Chikitsa, Basic Trends in Ayurveda and Therapeutic Approaches. And this book is published by CCRS in 2020. Around 17 articles he has published in national and international peer-reviewed journals. He has also published 3 articles in conferences proceedings. He has a vast research experience and associated with various research projects, also associated with the documentation of effective Marma practices, a documentary research project. Similarly, he is also related with the documentary research project, that is documentation for the Visa Chikitsa practices. He has also have a great experience in seminars, in workshop. He presented many papers and posters in international and national conferences and workshop. The remarkable one is, that is Danish Lymphedema Framework and Wound Healing Society, Denmark. So he is internationally acknowledged personality around us. Also, he was awarded with the Best Paper Presentation Award at Ashwini 2011, which is the International Conference on Ayurveda, which was held in Chennai in 2011. So his biodata is very vast, and he is very well known personality to all of us, and Marma, as you know, which is the core topic of Rachna Sharir. And I think the topic of today's his presentation is research trends in prospects of Marma Chikitsa. So sir has the vast experience of this field, and I also welcome you, sir, for this conference. I also welcome the today's chairperson, Dr. Sudhir Kandekar, sir. And I invite you, Dr. Pratap Shankar, sir, for your talk on the topic, that is research trends and prospects of Marma Chikitsa. Welcome, sir.
Thank you, sir. Thank you, sir. Hope I'm audible, sir.
Yes, sir.
Yes, sir.
Okay. So with the permission of the chair and the co-chair, shall I share my screen, sir? So hope my screen is shared. My PPT is shared.
Yes, sir.
Okay. Shall I check it is moving? Is it moving, sir?
Yes, yes.
Yes.
Okay, fine. Okay. So namaste all. So very good afternoon for all the faculties and students who are attending this conference. And so with due respect to the chairperson and the co-chairperson, let me start my session. So today is a Sunday and an afternoon session. So after a heavy meal, and it is an online session also. So the conditions are not favorable for my session. Hope I will, I will overall, I will pass over all these hurdles. That is with, I will make this, I'll try to make this session that is more informative and more interactive and interesting. So let me start my session. So my the topic of today's session is the research trends and prospects of Marma Chikitsa. Actually, as per the that is my biodata told by sir. Actually, I am a Shalya person that is basically trained in anorectal surgeries. But after joining CCRS, that is for the past 4 to 5 years, I have been involved in that is documentation of Marma Chikitsa, and that is CCRS conducted a documentation research project. So I will be telling about this project in my session. So my relationship or my interest area of interest in Marma Chikitsa started after this documentation, and after this documentation project, my clinical interest was more on Marma Chikitsa practice. And so I will try to share those clinical that is the experiences, and also the research, what is the present research trends in Marma Chikitsa. So with this brief introduction, let me go into my session. So myself, Dr. Pratap Shankar, Research Officer, National Research Institute for Panchakarma, Thrissur. It is under CCRS, Ministry of Ayush. So let me start my session. So as you all know that Marma Chikitsa, which is based on the human anatomy and physiology, and utilizes various vital points or areas of the body for preventive and therapeutic health benefits. It involves various manipulative techniques and 2 complex procedures. That is complex procedures like Abhyanga, Bandhana, Upanahas, etc. So we all know that what is Marma. So Marma are the various seats or specific locations of prana, that is pranasthana in the body. So before going into the topic, I will give few that is introduction part of Marma, so that it will be a continuous lead. So as you know that Marma is a pranasthana. So the prana, we know that it circulates throughout the body, and when this prana is located in a particular part, and when this particular part is injured, it becomes either fatal or it can cause deformity to the body. So the word Marma is formed by 3 syllables, Ma, Ra, and Ma. The Ra symbolizes Agni and Ma symbolizes Soma. So we can understand that the Agni part, it is ensheathed or it is protected by the Soma part. That explains the importance of Marma. And the disease of Marma affecting Marma comes under Madhyama Roga Margas. So usually we can understand that it is commonly affecting the Sira and Snayus, most commonly. We all know that there is exogenous factors, there is Aganduja cause for Marma Abhigata, but there is also Nija, that is the endogenous cause also. That is, for example, let me make it clear with the example. That is, for example, in the case of Vada and Kapha getting vitiated and located in the Snayu and creating Snayu Gata Vada in the wrist can cause CTS. So there is a Nija Anubandha also in Marma Abhigatas. And as Vedanta Darshana has mentioned 5 types of koshas, Pranamaya kosha is related to Marma. So when we see the functional and there is a structural and functional aspect of Marma, we all know that Marma is nothing but Mamsa Sira Snayu Asti Sandhi Sannipataha Teshu Swabhavada Ye Vishesha Pranas Tishtanti. That is, structurally Marma is a junction of Marma, Sira, Snayu, Asti, and Sandhi. So it is classified based upon the constituent and also its locations. That is the common classification. That is, as we all know, that it is classified by Sushruta as Mamsa, Asti, Snayu, Sira, and Sandhi. And apart from that, Vagbhata has added Dhamani also in the classification. So based upon the location, that is in the Shadanga, Marma can be localized in the upper or lower limbs, in the trunk, which includes the chest, abdomen, and back, and also in the head along with the neck. So when a group of Marma, which is located, that is a larger number of Marmas, when is located in a smaller area. For example, if it is located in the Shiras, those we call it as Mahamarmas. That is, as mentioned by Charaga, that is in Trimarmiyam, he has mentioned here Shiras, Hridaya, and Basti as the Marmas, Mahamarmas. So when we analyze the Tridosha predominance in this Mahamarmas, we can that is identify that Shira Marmas are Kapha Pradhana, Hridaya Marmas are Pitta Pradhana, and Basti Marmas are Vata Pradhana. So those Marmas are located deeply, that is, as I mentioned, it is located in Madhyama Roga Marga. But for the structural identification and also for the easy for surface anatomy, the Marma points are identified and the sizes are given to Marma points. That is half angula, maybe 1 angula, 2 angulas, or 3 angulas, or size of the palm, that is thala. And as for the prognosis or the effect of injury, it is classified as Sadhya Pranahar Marma, Kalandra Pranahar Marma, Vishalegna Marma, Vaikalegra Marma, and Rujakara Marma. So what I told earlier is a structural understanding, and this is the functional understanding. So we all know that marma is the 6 of prana or pranasthana. So all the 12 pranas, that is the agni, which indicates the 5 types of pitta, the soma, which is the energy part, and the vayu, which contains all the 5 types of vada, sattva, rajas, tamas, the that is trigunas, panchendriyas, and bhutatma. This forms the 12 pranas, and this pranasthana is nothing but marma. So we all know that the symptomatology of marma injury, that is brahma pralapa padhanam pramoho vijeshtam samlayano ushnatecha srastangata murchana murdha vadas tivra rujo vadakrtascha tastaha mamso udagabam rudiram cha gachet sarve indriyartho uparamastadaiva dashada sankeshu api vishakteshu vikshakteshu samanyato marmasu lingam uktam. That is, Sushruta has beautifully explained in the 25th chapter, where he mentions about the Ashtaveda Shastra Karmas. So here he mentions that is while telling about the Ashtaveda Shastra Karmas, that is what are the complications can arise. That is, when you analyze these symptoms, it is almost correlating with the different stages of shock. So when we see the different types of marma abhigadas, that is, for example, in Sira marma abhigada, it can be correlated with the hemorrhagic stroke. That is the Surendra. It can be mentioned. It is mentioned as Surendra Gopa Pradimam Prabhudam Raktam Sarvet. That is, it indicates a hemorrhagic shock. And when we analyze the snayu with the lakshanas, that is kaubjam, sharira avayava sadaha, kriya shakti, that is, it affects the structural, physiological, and functional. It can cause the functional disability to the body. And if it is sandhi marma abhigada, then it can cause that is the symptoms similar to septic arthritis or infective arthritis, like shofa adivardhi, ruja, balakshaya, etc. And when you analyze the Astividya, that is Astividya marma lakshanas, it closely resembles with the disease of, that is the affecting astis, for example, osteomyelitis, or it can be that is fractures of the bone. So when we analyze the importance of marma, that is, it is mentioned by Sushruta as it is marmani shalya vishayardham. That is, it is off of, that is 50% of marma, that is shalya tantra is based upon marma. That is, if a person knows about the marma, he will be understanding 50% of shalya tantra. Why means because that is, he mentions that if there is a marma abhigada, immediately the patient dies. Yasmaja marmasu hada nabhavanti sadhyaha jivanti tatra yadi vaidyagunena. That is, even though because of the shreshta vaidyagunas, that is the interference of vaidya, even though he becomes alive, but it causes vikalatvam assamshayam. That is, it can cause deformity to the body. It is undoubtful. So with this importance of marma, we will understand what is the importance which is mentioned in Ayurveda, but we'll be having a doubt, that is whether marma chikitsa is mentioned in Ayurveda or not. So we might have read in the that is Rajana Sharira, that is we have mentioned, that is we have read about the preventive aspects of how to prevent the marma abhigadas. But there are also curative aspects of marma abhigada mentioned, but it is sporadically mentioned in different chapters. That is, for example, it is mentioned in Varana Jigilsa, Shashti Upagramas, Bhagna Jigilsa. That is, and also the management of residual damage of the marma abhigadas can be done in the general line of treatment of dosha jigilsa, like shodhana and shamana jigilsa, vada vyadhi jigilsa, samnyasa jigilsa. So when we analyze the general principles of management of sroto dushti, that is, for example, in sroda adipravarti, that is in case of marma diseases, in the case of sroda adipravarti, usually what we'll do is we will bring back the doshas to its site, and we will immobilize that part by bandhana. That is for this atipravarti. And if there is a sangha, we will do abhyanga or any types of manipulation. And if there is any type of vimarga gamana, we bring back the doshas to its site. We will make the that is the normal gadi of vada, and we keep we try to keep the dosha in that particular part. So there is also indirect reference of application of concepts of marma in Ayurveda. That is, we can understand the application of talam on the head during panchakarma procedures, that is to protect the adipati marma. Massage of that is souls and various other parts of the body during the process of nasyakarma. That is ashtanga sangraha, beautifully as mentioned, that is datta matretu tasya karna kesha bhumi ghanda manya skanda pani pardalanu mardayet. That is, during nasyakarma, we have to massage all the parts present in the head and neck, and also the tala and pani padtala, it directly or indirectly mentions the importance of marma, which is present in this head and neck, and also in the marmas, which is located in the foot, that is sole, and also in the hand. And when we analyze the Pumsavana karma, it is specifically mentioned that is the right side and left side, importance of right and left side of the body, which nothing but implies the Ida and Pingala, which is mentioned marma concept. Which is mentioned in Yoga Shastra or in Varma Chikitsa, Varma Shastra, which is available in Tamil tradition. And the other treatments procedures like Bandhana, Lebana, Vasti, Dara, Sirodhara, Shiravasti all have a indirect or direct that is a relationship with marma and sthanas. So practically we can say that marma is practiced all over India in these three different schools. That is, it is practiced as a classical Ayurveda tradition of marma, and apart from that, it is practiced as a Varma Shastra in Tamil Nadu and adjacent part of Kerala, and also as Kulayana marma or Kulabhyasa marma in Kalari. As we all know that Kalari Pite, which is a Kalari Chikitsa, also it is very famous in Kerala and also in the adjacent part of Tamil Nadu and Karnataka. So these are the various schools. I'm not going into the details of this because it is beyond the scope of this session. So there is, as I mentioned about Varma Shastra, there is always a controversy between Marma and Varma. So they always, there is a, we regard, or it is mentioned that as Marma and Varma are different. But when we analyze the various Sanskrit literatures and the Vedic literatures, Marma and Varma are used at the same time. That is, it is extensively used in all Sanskrit literatures. Both, it is numerous references are available in Vedic literature. And specifically, we can see in Rigveda, it is mentioned as Marmani te Varmana Chadayami Somastva Rajamritena Vastam. That is, it is mentioned that is Marma, that is Mrima, it causes Maranam, meaning that which causes death, and Varma, which protects the body. So the Marma, which is covered in Ayurvedic text, it deals with the point which can cause immediate death, or it can cause disabilities, or it can cause pain, etc. Or the Varma, which is Varma Shastra, which is practiced in Tamil Nadu, it protects the Marma, and it is used mostly as a therapeutic aspect in Varma Shastra. So when we analyze the therapeutic aspect of Marma, so as we all know that if there is an injury to this Marma points, as I told, it is a Pranasthana, injury to this Marma point direct over the Marma point or in the peripheral of the Marma point, it can cause either fatality, or it can cause some disability or pain. So when we use these principles, when we have a direct and with a controlled stimulation of this Marma, it can act as a therapeutic, as a therapeutic role also. So this Marma, when used as a controlled stimulation, can cure many diseases. It is natural, it is non-invasive. We can say no drug, or it is a minimum drug used. It is instant, which can give instant relief, and it is a holistic healing. That is, we are not only treating the particular Marma point, but it can be the entire body is treated, because we are re-establishing the flow of prana. That prana will be, when it is blocked in one part, because of this Marma stimulation, that prana is liberated and it flows continuous, and there is a re-establishment of this prana flow, and so because of this there is a holistic healing. And there is a number of acute and chronic ailments can be cured, varying from acute injuries to chronic ailments like degenerative chronic injuries, that is repetitive strain injuries. All these can be treated with this Marma treatment. So every science has its own strength and weaknesses. So we can, there is a strength we have, we can say that it is a complete science because it has its own philosophical background. It has its anatomical and physiological background, very strong anatomical and physiological background. And can be used as standalone therapy, or it can be used as adjuvant therapy with any other Ayush systems. Or it is effective in a larger spectrum of diseases like musculoskeletal disorders, neurological disorders, neuromuscular disorders, neurodegenerative disorders, metabolic disorders, etc. It is simple, painless, and gives quick results, and it is very cost effective also because of less drug involved, and it reduces the burden of medications. So it has a very vast literature. We can get very vast literature that is we can see in the Ayurvedic literatures and also in the Tamil Varma Shastras. That is there is almost thousands of manuscripts are available in Tamil Nadu related to that is Marma Chikitsa or Varma Shastra. But it has certain weakness also because there is a lack of standardization of the points. Because nowadays we doesn't know how much pressure we have to identify and where the correct points are present, Marma points are present, and the methods of stimulation of these Marma points and methods of protecting these Marma points are still, it is unknown, or it is not clearly known. And it requires a strict discipline to learn the science. Okay, and also there is a if you are not properly practicing it, it can be very dangerous when you use it wrong. And unfortunately, very few experts are available in this field. And most of the literatures are confined to a single language. That is, as I told, Tamil language contains most of these manuscripts related to Varma. And there are very less scientific evidences and publications. So this is my topic today. So where there is very few research has been undertaken in Marma Chikitsa. So I will be telling about this research trends which has happened in Marma Chikitsa and what are its prospects and how we can do the future research in Marma Chikitsa. So with this certain introduction of Marma Chikitsa, I will be going into my session. So let me let me throw light over a few research works which has been conducted in the Marma Chikitsa. So it is both a qualitative and quantitative research. So let me start with our research. That is, it was a documentation project which was conducted, which was started in 2018. It was a documentation research project, and in this project, that is, we conducted a survey around that is Tamil Nadu, Kerala, and also in different parts of India. We collected details of a list of Marma practitioners, and we went to them. We collected. We stayed with them. We did video documentation and audio documentation. We collected the different Marma Chikitsa practices which are done by these traditional practitioners, and based upon that we prepared a protocol, and this was published as a book under CCRS, which is termed as Marma Chikitsa Basic Tenets in Ayurveda and Therapeutic Approaches. And this book is available in all CCRS institutes, and it covers a comprehensive that is research that is overview of the documentation what we have done. In this, there is a collection of data from these practitioners based upon the treatment experiences. And based upon this documentation project, we have started a training program for doctors. That is a 1 month that is a certificate course for Marma Chikitsa also. So let me that is tell about few studies which have been carried upon Marma Chikitsa. That is, first of all, I will tell about a survey study which was carried on to study the Kurpara Marma in relation to its Vaikalyakara effects when injured. So in this study, 80 patients having trauma of elbow joints due to various causes were included. And these patients were observed for 3 months for any changes in the symptoms. So we all know that Kurpara Marma can cause Kunitva. Apart from that, the symptoms of Vaikalyakara Marmas are like swelling, loss of power, restricted movements, and muscle wasting, and associated symptoms like tingling sensation, heaviness, syncope, sweating, dizziness, and vomiting. All these were kept as the inclusion criteria. And the analysis was done on the admission time and also after 3 months. So it was found in this study that in the survey study that almost all the patients, that is 100% of patients had a swelling and loss of power, and 90% people had Kunitvam on admission. And after 3 months, 50% remained that Kunitvam effect, that is the deformity remained even after 3 months. And 72 patients had restriction in flexion and extension deformity, which still remained in 50% of patients. And Kurpara, so they concluded that Kurpara Marma is definitely a Vaikalyakara Marma. And the disabilities like a restriction of movements, swelling, atrophy remains in an injured elbow joint in spite of even the best treatment available. So as I mentioned earlier, that is, even though if you are giving a best treatment to the Marma Abhigadas, it can cause Vaikalya, that is Vikalatvam. So this is another observational study which was done to analyze the Kukundara Marma with the manifestation in weightlifters with respect to sciatic nerve injuries. So a total number of 30 weight lifters with the low back injury were assessed. So they concluded that sacroiliac joints is the most appropriate anatomical structure with the Kukundara Marma So as we all know, the Kukundra Marma is a Sandhi Marma and it is a Kalantara Pranahara Marma. And but when you analyze the symptoms of Kukundra Marma, it closely resembles, they conclude that it closely resembles the sciatic nerve injury, because we know that Kukundra Marma Abhigata can cause loss of sensation and motor power loss. So it was closely related to sciatic nerve injury. And they also concluded that injury to the periphery of Vaikalakara Marma can cause Rujakara Vidya Lakshanas also. So this was their finding in the observational study. So these two studies, by these two studies, we can understand that certain observational studies or survey studies can be carried on. So based upon this examples, we can carry on the survey studies or observational studies and other type of marma, for example, in Manibandha marma or in Talahardai marma or Kshipra marma, etc. And its relationship with the prognosis and also its the modern correlation also. So such observation studies or the survey studies can be planned. So these two studies are examples for that. So let me introduce for certain, that is a research which has been underdone in Marma Chikitsa in non-communicable diseases and also in the rehabilitation medicine. So this is a very interesting study. It was a non-randomized control pilot study. So in this study, there is Marma therapy for post-stroke rehabilitation was undertaken. That is patients with both ischemic and hemorrhagic strokes are included. And in that, in the intervention group, there was a standard treatment along with the Marma therapy. And in the control group, only the standard treatment was given. So in this, there is around 30 patients were studied in this pilot study. So it was mainly to examine the feasibility and acceptability issues of the intervention study, that is the protocol, and also to gather the preliminary outcome data. So the feasibility was studied through recruitment and response rate, and also the loss to follow. And the acceptability was done through patient interviews. And the outcome measure was fixed as the Barthel index. So it was found out that the recruitment rate was very high. That is, the feasibility was and the acceptability was very high. Recruitment rate was 15.1 per week, and response rate was 91%. And the loss to follow was very less. That is less than 30%. But interestingly, it was found that the effectiveness data, that is in the case of Barthel index, showed very significant. There is no significant differences in both the groups. But however, interestingly, it was found that the secondary measures, that is during the follow-up, that is the motricity index, which is after the follow-up, that is after 6 weeks or 12 weeks, the motricity index and also the trunk control test, which was very significant. And so this suggests a possible greater improvement in intervention group. So this was their conclusion. So by this, we can understand that there is a prolonged effect of Marma Chikitsa. Even though it is doesn't give a immediate effect in stroke rehabilitation, there is a prolonged effect. It can give effect after 6 or 12 weeks, because it has to be done for a continuous period, so that it can give a prolonged, or it requires multiple sittings. So this was another very interesting pilot clinical trial. It was a single arm clinical trial, and this was done to find out the feasibility and acceptability of a manualized Ayurvedic nutrition and lifestyle intervention for breast cancer survivors. So it was a 4-month individualized Ayurvedic intervention, which included counseling on nutrition, lifestyle, yoga, and Marma stimulations. So it was a 8 1-on-1 visit trial. So in this, feasibility and acceptability was studied, and the quality of life was of the patients were studied, with sleep disturbances are analyzed, and depressive symptoms are analyzed through depression scales. Fatigue was analyzed through Lee fatigue scale, and stress through PSS scale. This was analyzed during the prior treatment, midpoint, and the end of the 4th month intervention. So it was found that the feasibility and acceptability was very good. That is, there was a retention of 84%, and adherence to the treatment was 19.5%. There was very significant improvement in the quality of life. That is, emotional functioning, cognitive functioning was very good, and the sleep and also the depressive scales showed a very good improvement. And there was only moderate improvements in the global health, and in the fatigue scale, and also in the stress scale. And they have concluded that there is no adverse events during the intervention period. So both these studies are are nothing but a pilot study. They took minimal sample size of 30 or 32. So, but unfortunately, there is no available data of their continuous study. That is, they didn't I understand there is they didn't undertake any randomized controlled trial after this. So this is a very important scope for us. So we can undertake this with the base of these pilot studies. We can undertake projects or research. We can frame research protocols in rehabilitation and also rehabilitation, post-stroke rehabilitation, and also in rehabilitation of cancer patients. So this is a very interesting study, which was a crossover design, which was done for to analyzing the physical and psychological effects of a head treatment in the supine position. And there is same 24 healthy female students were included in the intervention group. That is, intervention group, they did the head massage or the stimulation of marma points, and the control group, just it was a bed rest alone. And this the same 24 healthy female students underwent both the interventions with a gap of 1 week between each treatment group. So it was a crossover design, and they analyzed the physical and psychological effects of the marma treatment. So marma was done as a 7-minute treatment. So they analyzed through physiological indexes like blood pressure and heart rate fluctuation index. And they analyzed there is a psychological effect through liveliness, depression, and boredom through visual analog scale, and anxiety through anxiety was measured as state anxiety through a scale called state right anxiety inventory scale, and found they found that there is a physiological effect was there. That is there is a parasympathetic nerve activity increased immediately after stimulation, and this gradually decreased thereafter. So this was their main finding physiologically, and there was a psychological effect also. That is, the feeling of liveliness increased, depression and boredom decreased, fatigueness and the state of anxiety decreased after the treatment. So they concluded that head treatment, that is nothing but including the massage and marma stimulations, it offers relaxing and refreshing effects. So this is a case report which was done on the blood pressure normalizing effect of Thalahridaya marma. So I included this to show the multimodal and multidimensional effect of marma therapy. So we can understand there is no relationship with Thalahridaya marma and hypertension. But this case report found that that is when they analyzed a volunteer that is was subjected to Thalahridaya marma therapy. That is a classical Thalahridaya marma point was identified in the and physical stimulation was given in a controlled way for 10 days. And the patient was also performed self marma stimulation also. So in the right side, we can see a table, their observations. It was very interesting. That is the patient who had a very high systolic and diastolic pressure, that is 171 and 162 before the treatment, which was, sorry, 171 and 97, which gradually reduced to, that is the 133 and 79 and 120 and 72 after the 10 days of marma stimulation. So this study, even though it's a case report, it is a leading stone, or it can be a, what to say, a link to other. We can frame many research protocols in marma stimulation in NCDs, that is in hypertension, also in diabetes also. That is, for example, in Varma Shastra, many points are mentioned for control of diabetes also. That is, they have mentioned the marma which is present in the thigh, that is I remember it is amai, it is called amai talai. That marma point is very good for controlling diabetes. So we can that is take up these type of studies. That is, we can take up certain we can analyze certain marma points which can be very effective in controlling these non-communicable diseases. So as I mentioned earlier, it has a very good effect in stroke, cancer, rehabilitation, and also we can see that it is having effect over the hypertension also. So when we see about the rehabilitation of marma injuries, so I will show 2 case reports on traumatic spinal cord injury and also a traumatic brain injury. So this is a case report which was done on there is a rehabilitative potential of Ayurveda for neurological deficits, which is caused by traumatic spinal cord injury. So in this study, they found out that It was a case report, and it was called, that is, they have given a group of Ayurvedic internal medications and external medications, which is we can see in the table 2, which is a Panchakarma treatment. That is Pinda Swedam, Grihavasti, Shirovasti, and Kalavasti. And they found out there is a neurological, very good neurological improvement before and after treatments. That is, after 3 months of treatment, there is a very good neurological differences in both sensory and autonomic deficiencies. So this is a study which was done in this was a case report which was done in it was a retrospective case report to study rehabilitation of residual neurological deficits caused by traumatic brain injury. So in this group of medicines, intermedicines were given as per phase. That is Dashmula Kwadam, Dhanvandra Kashayam, Dhanvandra Sevyam, Prasaranita Kashayam, Kalyanagridam, and group of Panchakarma treatments was done. That is, you can see in the right hand side. That is Churna Pinda Sweda, Jambira Pinda Sweda, Nasyam, Abhyangam, and Shirodhara Tarpanam, and Shashtika Pinda Swedam, and Pudabhagam was done in this case. And when the functional impairment measure score was done, it was 61 before treatment, 119 after treatment, and 126 during the follow-up of 3rd month. So we can conclude that is the Ayurvedic treatment or the Panchakarma protocol and the rehabilitation procedure is very good, very effective in treating all these types of spinal cord injuries and traumatic brain injuries. So Marma Chikitsa and degenerative disorders. So very few research has been done in this field. So there is a very good potential in this field. So this is only one study available on osteoarthritis. So it is evaluation of efficacy of Marma therapy with Januvasti. That is, they did Marma stimulation in 4 Marma points. Along with Januvasti was done. It was evaluated on 20 patients, and it was done for 9 days. Follow-up was done for 1 month, and the patient was advised to do self-administration Marma therapy at home also. And they found out that there was significant improvement in the subjective parameters and also in the objective parameters like WOMAC index, range of motion, walking time, etc. So this study is a stepping stone for to show the efficacy of Marma therapy in various degenerative disorders. But unfortunately, very few studies are done in degenerative disorders. So it is, I think it is we have to the present generation or the future generation has to take up this challenge, and they have to do more studies on degenerative diseases. So this is a very scope and of Marma Chikitsa in sports medicine. Nowadays, sports medicine, that is, many people are practicing Marma Chikitsa in sports medicine. So I want to throw a few points over this topic also. So we all know that sports medicine relates with physical fitness, treatment, and prevention of sports injuries. So there is a close relationship with spinal injuries and Marma injuries, because we in Ayurveda Marma, that is mostly related with the details of injuries. So there is a close relationship with sports injuries and Marma. And there are several concepts in Ayurveda can be correlated with sports injuries. For example, like Sadhyo Vrana, Vrana Shofa, and Vrana Chikitsa, and Snayu, Mamsa, Asti, Sandhigada Vadas, Nidana, and also their Chikitsa can be adopted in sports medicine. Bhagna and Sandhimoksha treatments, Vadarakta and Vadavyadi. So all these concepts can be incorporated in sports injuries, and we can manage sports injuries very well with these concepts. So these are the treatment strategies which we can apply in sports medicines. That is, the internal medicine should be aimed on elevating the pain and associated symptoms like inflammation, tenderness, swelling, etc. And it should be help in boosting the tissue healing. It should strengthen the injured part by tissue healing and also by muscle strengthening. And it should also aim in preventing post-traumatic complications like, for example, in knee ligament injuries, it can cause osteoarthritis. But there are apprehensions in using this internal medicines in sports injuries because of the fear of doping. But we can overcome this by incorporating internal medicines through diet and nutrition. That is, we can give toyas, paniyas, soups, and several other type of diet and nutrition can be incorporated. So external treatments also should be aiming on alleviating pain and other mainly associated symptoms like the stiffness, and should be aiming on rehabilitation. It should strengthen the injured part, and many Ayurvedic protocols like Lepa, Daras, Kashaya Daras, and Taila Daras are very useful in sports injuries. And bandhanas, herbal bandhanas, Ubanahas, Abhyanga, Svedana Kriyas. All these can be used in different stages of sports injuries, that is starting from acute injuries to chronic injuries. And also Vasti can be, that is especially Matra Vasti can be useful for tissue healing and for improved muscle performance. And we can incorporate Agni Karma, Anishastra Karmas like Agni Karmas, Iravedana, Jalogojarna in reducing the pain and inflammation factors. And finally, we can incorporate physiotherapy along with this Ayurvedic treatments to Madam, I lost my, there is a current. Hello?
Yes.
Madam, can you hear my?
Yes, sir. Sir, you're audible.
Your PPT is also audible.
Actually, sir, I'm having a power cut out. Can you share the slides, madam?
Sir, I'll share.
Okay.
Sir, you need to stop sharing. Only then I'll be able to share. Hello. Dr. Shankar, sir, am I audible?
Yes, madam. Yes, madam.
Sir, please stop sharing. I'll share the screen.
Yeah. I have stopped it, madam.
Go to slide number 34.
34, madam. 34.
Yes, just a minute. Is it visible, sir?
Yes, sir. It is. Yes, madam. It is visible.
Thank you, sir. So please, you may continue.
Yeah. Sorry for the interference. It can be utilized in this rehabilitation of sports persons. So next slide, madam. Yeah, if we see that what is the advantage of Marma Chikitsa in sports medicine, it is useful in both acute and chronic conditions. That is, it can be used as that is very effectively in acute injuries like sprains and ligament injuries also, and also to chronic conditions also. So it is very ideal in tissue healing and improve muscle performance. And it can ensure that there will be an early rehabilitation with normal strength to the sports person. And it can give a speedy recovery to the person, because these sports persons, they require a very speedy recovery, because they want to get back to their normal sports activity at the earliest. So that is very important for these people. Our treatment can give a speedy recovery, and that can help them to return to the practice and the field, and it can prevent recurrent injuries also. And also that is, as we know that during the recent Commonwealth Games also, we lost many medals because of this recurrent injuries to our athletes. So this can be prevented through our treatment also, and it can prevent many degenerative diseases in their future also, because it can prevent osteoarthritis of the joints, and it can enhance their physical endurance also. That is, the certain Panchakarma procedures can enhance their physical endurance, and by this they can attain physical and mental fitness. Next slide, madam. So this is, I will share two very interesting study on this sports injuries. This is one of the study which is done to identify the effectiveness of Ayurvedic treatment protocol in knee ligament injuries. So this was carried on in our institute. In this treatment protocol was consisting of internal medicaments and external treatments. So in this, it was observed that in 20 patients of ligament injuries, it was the ligament injuries and meniscal injuries ranged from complete tear to partial tear. And the patients were studied with knee outcome survey and international knee documentation scores. And it was found that there was significant improvement in the parameters of pain, swelling, and functional disability of the knee joint. And it was found that statistically, statistically significant differences was found in the both scores. That is the KOOS score and IQDC scores in the pre-treatment, post-treatment, and after a follow-up of 3 months. And it was found that the patients were able to return to activities of daily living, that is with improved joint stability. So this was a very good observatory report, and this was published in a Scopus Index journal. So this is very good example for that is the management of that is all application of Ayurvedic treatment protocol in knee ligament injuries. So this is another a protocol-based management of common sports injuries through integrated approach of Sandhi Marma Bigada, which was an open-label clinical trial. And in this, they did a phase-wise treatment with integration of Ayurveda and physiotherapy in 30 patients with sports injuries. And in this, they included diagnosed case of common sports injuries within 7 days. That is, they included acute injuries. So in this, they found out there was a significant changes in pain, tenderness, swelling, local temperature, manual muscle testing, and range of motion at different time points. So both these studies prove us that is there is a very good we can if we frame up a very good Ayurveda, that is a Ayurvedic treatment protocol, well designed Ayurvedic treatment protocol, then it is a very success. We can that is we will find a very good success in sports injuries and sports person rehabilitation. Next slide, madam. Next slide. Yeah. So this is when we see the Marma Chikitsa in chronic injuries. Next slide, madam. Yeah. So chronic injuries, we can say it is a repetitive stress injury or occupational ovaries injury, or it can be called as a repetitive motion disorder, cumulative trauma. So several names can be given to these chronic injuries. So we can understand that the overuse or of the part or the stress induced to the Marma injuries to that part can cause this type of stress injuries. It can be workplace. It can be caused by major factors like workplace environment. That is same task repeatedly doing with little variability, decreased time for rest, and increase in expectations. So all this can be found out in nowadays lifestyles. That is, for example, in the case of persons working in IT company, they undergo all these situations. So they have these all types of repetitive stress injuries. So these injuries include nerve injury, dislocation, tendon inflammation, and overuse stress fractures. So a number of diseases come under this chronic injuries like CTS, as I told earlier, that is the carpal tunnel syndrome, bursitis, epicondylitis, tendinitis, ganglion cyst, tenosynovitis, and trigger finger. All these comes under the chronic injuries or repetitive stress injuries. So the treatment is depending upon the prevention of etiology. Early diagnosis and appropriate treatment is very important. So all these conditions can be easily managed, or we can effectively manage with stimulation of the related Marma points, and through certain Marma, through certain Ayurvedic treatments like Lebas, Ubanahas, Dara, and Agnikarma. So certain internal medications can also be used to reduce the inflammation, to enhance the tissue healing, and also to prevent degeneration. Next slide, madam. When we see the different innovative formulations, or the normal, we can see about the different types of or the new novel drug delivery system can be developed based upon the different Marma pharmacology. Very few medicines are available in Marma pharmacology. So those medicines can be converted into new that is can be used in with the new drug delivery systems. For example, in South India, we use more of Thailas and Lebas. For example, Nagaradi, Leba we use, Muruvanna we use, and different types of Marmaguliga, Lebanas we use. So those things can be used as a hydrogel gel. For example, Nagaradi Churnam can be used as a hydrogel gel. And several Thailas can be converted as sprays and can be used in immediate acute injuries in case of sports persons. And several Avarti Thailas, for example, Dhanvadra Thaila, Kshirbala Thaila, can be converted into oil-based soft gel capsules. And certain our Thaila preparations like Dhanvadra Thailam, Muruvanna, Mahanaranam can be converted, or I think it is still it is available. It is nowadays it is available as ointments, creams, imugels, and liniments. And we can there will be that is we can have an innovative approach of transdermal patches of these Lebas for immediate pain recovery and also reduce the inflammation. For example, that is Nagaradi Churna Lebana in the case of plantar fasciitis. And in case of transdermal patches in sports injuries, immediate sports injuries, we can use Muruvanna Lebas, Muruvanna patches. So all these can be developed, and also plasters can also be developed. And certain herbal bandages can be developed in both in acute injuries and also in chronic injuries. And we can innovate the POP, which is nowadays available, that is a plaster of Paris, with herbal medicines as phyto POP. And we can use the cold packs. There is our certain medicines like Muruvenna, Manjishta, the Lebas, which is having a cold Shidaviryas, can be used as cold packs in acute injuries. And certain medicines like Toya, Paniyas can be converted into sachet packets, can be converted into powder sachets, and this can be given as an energy drink. It can be given as a, immediate drink to the sports persons, like the Sharanga Doyam or Drakshari Doyam, Karjurari Paniyam, etc. And certain drugs which to give the fast effect of certain marma drugs, we can convert them as a sublingual drops and also nanofilms. And we can convert certain our rasayana medicines like the Chavanaprasham, there's Agastha Rasayanam, that is the Narasimha Rasayanam, can be prepared as a Nutribars, Nutriballs, granules, and health drinks in the forms of soups also. So these are the various innovative formulations which can be undertaken under this in the sports medicines and also in the case of in the scope of acute and chronic injuries. Next slide. So finally, so what is the future ahead of marma researches? We can find out new indications of this marma chikitsa. That is, as I told earlier, we can do marma chikitsa in certain NCDs. So we can develop certain protocols for diabetes, hypertension, metabolic disorders, and we can develop protocols for rehabilitative in stroke, post-stroke rehabilitation, and also for cancer patients. So all these are new indications. So many research has to be undertaken. Many observative studies can be undertaken. Though we cannot do all types of RCTs, we can do observative studies. So observative reports, observative studies with a larger sample size, thousands of sample size is equal to these RCTs. So such observative studies can be undertaken. So why this marma chikitsa is mostly drugless, and it can be easily introduced to the public healthcare also. So we can introduce our marma chikitsa in the public healthcare system, and also which can be integrated with other Ayush systems also, and also with the modern that is the modern medicine also, physiotherapy also. So certain research has to be undertaken in this integration of our systems, and we can strengthen we can frame up different protocols which can be given to the Ayurvedic physicians, Ayurvedic community, to develop their clinical practice. So that so all these studies are based or should strengthen the Ayurvedic physicians' clinical practice. That is the ultimate goal of these researchers. And new windows of scope can be found at non-communicable diseases, degenerative diseases, chronic injuries, sports medicine, rehabilitation medicine, emergency medicine, personalized medicine, etc. So all these are new windows open to us in research prospects in marma chikitsa. And also we can develop new drug delivery forms of medicines, and also we can understand the various action of marma stimulation through the concept of fascia. That is, as we have two eminent Rachana Sharira persons here, they can throw light on this, because this fascia is it is what is a very lowly understood in anatomy. That is because nowadays fascia is given more importance in clinical practice, because fascia covers all the musculoskeletal part, all the organs. So it is considered as a internet net in the body. So our marma stimulation, as I told earlier, it is having a multi-modal and multi-dimensional effect. So this can be studied through fascia, through the concept of fascias, and also the understanding the logics of certain marma, that is Ayurvedic practices. As I told, like Nasya, Pumsavana Karma, all these can be understood through marma. So certain studies can be undertaken in this scope also. And we can explore the scope of marma in anesthesia, because nowadays we are having very usage of anesthesia, local anesthesias in surgical and parasurgical procedures. So we can innovate marma chikitsa in reducing, that is, we can use it as for local anesthesia or for pain reduction in post-operative period also. So certain research protocols or research studies can be carried on this subject also. And we can innovate our certain procedures like our Abhyanga procedures, our Svedana procedures, based upon the Marma knowledge of this, our Marma Chikitsa. So our Abhyanga procedures can be innovated. That is, different types of Marma strokes can be developed, like Pidana, Paripidana. Many types of Abhyanga procedures are available in Marma Chikitsa that can be incorporated into our Ayurvedic Abhyanga practice. So all these are the future ahead of this Marma Chikitsa and also its research prospects. So hope I am very to say short, and I have given a brief part to this research trends and prospects of Marma Chikitsa. So with this, I thank the for your patient hearing, and also for I thank the organizers for inviting me in this prestigious platform. And also I thank the chairperson, co-chairperson, and coordinator of this session. Finally, once again, I thank for all the audience for your patience hearing and for your attention. Thank you. Over to you, madam.
Thank you, sir. Thank you very much for your very knowledgeable session, talk on this today's session of research trends and prospects in Marma Chikitsa. I would now like to invite our co-chair, Dr. Khedekar sir, for question answer session for today's topic, research trends and prospects. So please take over for the question answer session. I request the participants, if they have questions, they can drop in the chat box or they can ask now. If there are many questions, with the permission of today's speaker, we can connect you to him also. Over to you, sir.
Thank you, madam. Today's topic was research trends and prospects in Marma Chikitsa. First of all, I congratulate sir for very well presentation. He has covered almost all the areas related to his topic. Basically, there is only one question in the chat box which I am seeing. That is, question is from Suruchi, and she asked that what we do in Marma Chikitsa means add pressure or what? This is the question from Suruchi.
Yes, sir. Shall I answer you, sir?
Yes, sir.
Yeah. So it is a very good question. Actually, the Marma stimulation, which is not that much explored in Ayurvedic Marma Chikitsa, but it is quite it is done in a very elaborate way, or in a very very good way in Varma Chikitsa. That is in Varma Shastra, which is done in Tamil Nadu and adjacent parts of Tamil Nadu. And in this, they have designed a protocol based upon the that is the Matrai Kanak, that is the pressure point, how much pressure has to be applied over the Marma point for its stimulation. So they have analyzed it, and they have standardized this point of there is a pressure of stimulation. For example, that is, I will give an example for that. That is, they have categorized this pressure. That is, they have given a pressure metrics for that. That is, for example, they have categorized as 1/4 matrai, 1/2 matrai, 3/4 matrai, and 1 matrai. So these 1/4 matrai to 1 matrai is for therapeutic purpose. Anything beyond that can can injure the Marma point. So, for example, if we want to give a 1/4 matrai pressure to that Marma, that is what they do is they give pressure from, for example, they give pressure only from the wrist part. That is, if you are pressing and releasing that Marma point, they give pressure from the wrist part. That is, giving pressure from the wrist can create 1/4 pressure. When we give pressure from our elbow, it can give 1/2. When we give pressure from our shoulder joint, it can give that is the 3/4 pressure. And if you are giving pressure from our entire limb, then it can give 1 matrai. And if you are giving pressure more than that, it can cause the injury to that part. So based upon this metrics, we can also frame a certain certain protocol to manipulate the Marma points. But certain, I understand that many books have elaborated this marma stimulation, and many practitioners are nowadays, marma practitioners are nowadays are stimulating marma points, I think. But there is a lack of standardization of these marma points is lacking. So we have to develop this standardization, its identification, and also the metrics, and also the what to say, how much pressure we have to apply. So all these things has to be developed. So I think we can what to say, get this, or we can borrow this point from our what to say, adjust, that is the other Ayush team, that is Siddha medicine. There they developed this Varma Shastra, that is the, they have developed this manipulating techniques quite a lot. Hope I have answered the question, sir.
Yes, sir. I think there is one more question in chat box. Sir, the question is from Nanda Santre. Question is that, can we give pressure by transcutaneous electric nerve stimulation as in physiotherapy?
Yeah, sure. That is actually this study was undertaken in this. I shared one study also related to the sports injury protocol. So in that study, that is they are, as I mentioned, that is they have taken a phase-wise treatment protocol in sports injuries. So in that, they in the initial first 2 phase, they have done Ayurvedic treatment of labors and internal medications, dharas, etc. But in the 3rd phase, they have used physiotherapies, like that is they have given physiotherapy as a ultrasonography methods, and also they have used this transdermal stimulations also. So these stimulations we cannot, that is there is still there is a need for understanding these type of treatments, how they can stimulate the action behind these stimulations in the understanding in them in marma perspective has to be done. But it is understood that they can stimulate the blood circulation, they stimulate the nerve channels, the blood channels, the muscles, and so all these are nothing but the marma. That is the it nothing but involves the mamsa, sira, snayu, asti, and sandhi. So we can indirectly say that it stimulates nothing but the marma points. But we have to understand, so certain studies still have to be undertaken to study the effect of these types of stimulations in marma points.
Okay, sir, thank you. I think there is no more questions in this session. Sir, I have one question regarding this. Are the marma points are similar to that of acupressure points?
Sorry, sir, I am not, I would say, expert in acupressure. But when we, so I'll share one experience, because when we went for a documentation project, as I mentioned earlier, we were involved in a documentation project. So we documented certain practitioners who did both the marma stimulations and also acupressure. So they had a concept that it is related, but that is as a scientific community, or we have to what to say, we have to do more research on that. I think it is both are different philosophical what to say, the base is different, because we have a very strong anatomical, physiological, and philosophical background. I don't think so acupressure doesn't have those strong background. Okay, it was, how to say, it was very recently developed. Our Shastra is having a very strong background, but still we have to find out there is any relationship, so that we can do some integrative research also. So we should not close our windows in that research aspects. So we have to find out those research, because as I told, we have to integrate with other systems also. So that window should be always open.
Yes, sir. Thank you, sir. Thank you. So I think there are no more questions for this session. I once again congratulate sir for the nice presentation and nice question answers for this session. And I'm very much thankful to the entire team of Ayurveda Teachers Association, especially President Dr. Rahul Suryavanshi sir and Dr. Nitin Chandurkar sir, and whole team of the ATA. Thank you very much, sir.
Thank you, sir.
And I hope if anyone has more doubts on this topic, they can have Sir, if Sir permits, they can have his email ID and they can directly clear their doubts from Sir. Again, we have eminent speaker as a chairperson today for the session, Dr. Sudhir Kandekar, sir. He has a vast experience of 15 years. He has been working in this field of Marma Chikitsa. I would like request our today's chairperson to share his expert opinion on today's topic of research trends and prospects in Marma Chikitsa. Over to you, sir. So please share your expert's advice.
Thank you, madam. First of all, I would like to express my gratitude towards ATA organization and the organizing members. Then I would like to express my gratitude also to the esteemed Marma Chikitsak Dr. K.M. Pratap Shankar sir for expressing his knowledgeable views about all aspects of the Marma science as well as Marma Chikitsa. Sir, you have done extensive work for this apratyaksham shastra. Actually, Acharya Charak said that pratyaksham hi alpam, apratyaksham analpam. The manifested things are very, very low in numbers, but apratyaksham analpam. The unmanifested things are very much in numbers in this universe, and thus the Marma Shastra is also has a pratyaksham knowledge. Very much. This is actually emerging Shastra today, and nowadays we Ayurvedian are very much alert or very much aware about this Marma Shastra. Actually, I have practiced or I have been practicing this Marma Chikitsa since last 15 years, and in Maharashtra there is no Marma Chikitsa at that time, and I am okay. मेरी चिकित्सा दृष्टि से मैं इसके ऊपर काम कर रहा था, but now lots of Marma Chikitsak are prepared in this present era. Dr. Pratap sir, you have short analyzed this particular Marma Chikitsa, that is you express view about the strength of this Marma Chikitsa, that is it has instant relief or at the low cost. Okay, then its weaknesses. It has no protocols or very less protocols. Marmasthans are very different in the individual perspectives. Okay, opportunities in various conditions. We can opportunate this particular pathy or modality, and lack of standardization and acceptance is the threat. So we can overcome these threats or weaknesses in near time. So I would like to thanks to all of you for this valuable session. Thank you. Thank you.
Thank you, sir. Thank you for your expert comments on today's topic. I have a personal request to Pratap Shankar sir. CCRS has been doing a great job in this field of Marma, which has been a very underexplored topic. Sir, could you please guide our faculties and even students on the courses conducted by CCRS? I think at Trisur Cheruturthi, they have a 1-month course on Marma Chikitsa training. Could you please throw some light on that?
Yes, madam. Sure. Actually, we are having a 3 months course for Panchakarma also. So that is, it was almost 17 years it has been started. So this is a 3 months course. This for doctors, for BMS doctors. This is they will get a comprehensive training, hands-on training in Panchakarma, different Panchakarma procedures. So it is for 3 months, and it is conducted every year in 2 batches. That is, we have a July batch and also in December batch. So we have 2 batches. So in between that, we have another certificate course on Marma Chikitsa. So based upon our that is the research study, we have a we have started a certificate course also, and this certificate course is for 30 days. And this certificate course will be taken by different almost 30 Marma practitioners all over from India. They will give an hands-on training to the Ayurvedic graduates, and all these are hands-on training offline programs. So we also have a that is Panchakarma therapy course also. That is for it is not for doctors, but it is for a general public for 10th and +2 students. So these are the 3 courses we are conducting in our NARIP Institute. So the details of these are courses are available in our website, CCRAS website. The Marma Chikitsa course is conducted every year. 2 batches will be there in May and October. So you can send application via email. It is all available in our website. Thank you, madam.
Thank you so much, sir. I'm sure this will be very beneficial for all of us. Thank you, sir. With this, we come to the end of this session. I would like to propose the vote of thanks for today's session. I'm extremely thankful to Ayurveda Teachers Association for giving me this opportunity as a session coordinator for today's session. I'm really delighted that we got to hear such an eminent researcher, eminent speaker, Dr. Pratap Shankar sir from National Ayurveda Research Institute, Trisur, Kerala. CCRS has been working in this field, and I'm sure there will be more researches coming out of it. I'm also thankful to sir that sir has shared one of my research article in his talk today. It was really a pleasure to see our own article being quoted. Thank you, sir. It was very knowledgeable and practically applicable session today, sir. Thank you so much. We are highly obliged and happy to have eminent person as a chairperson today, Dr. Kandekar sir, who shared his expert advice on today's topic. Also, Ayurveda Teachers Association is pleased to have our co-chair, Dr. Sachin Khedikar sir, for gracing this event and conducting various sessions. Thank you, sir. Thank you for sharing your knowledge and coming as a co-chair to this session. Thank you, sir. I'm also thankful to Dr. Amar Kamble sir and Dr. Sonia Dahat madam, today's day coordinators. This program couldn't have been successful without their constant help and support. They have always stood as pillars for conducting this session. Thank you, sir and ma'am. And last but not the least, I'm extremely thankful to all the delegates for their patient hearing. Without you, this wouldn't be possible. This session wouldn't have been successful. With this, I declare the end of this session, our 4th session, that is research trends and prospects of Marma Chikitsa. I'm sure everyone must have benefited out of this extremely knowledgeable session. You are definitely taking some research ideas, something which sir has conveyed. You can work on these research ideas, and definitely we can bring great on this underexplored topic of Marma Chikitsa. I hand over the session to today's day coordinator, Dr. Amar sir and Dr. Swati madam. Thank you so much, sir. Over to you, sir. Hello.
Thank you. Yes. Thank you, our speaker, for the fourth session, Dr. K.M. Pratap, sir. Sir has given many ideas regarding the researches in the murmur topic. And I'm sure that after attending this session, the various new upcoming research ideas on the topic of the murmur can take this topic of the Rachna Sharir to the new heights of the innovation. Sir, your lecture must have stimulated many ideas in the Urdhratrugat murmur of our delegates for the scope of the research in murmur as a main treating modality or in the adjuvant to the other treatment protocols. I also thank Dr. Sudhir Khandekar, sir, who chaired our session. I also thank from the bottom of my heart Dr. Beloved Sachin Khedekar, sir, for the beautiful conduction of the question and answer seminar, question and answer session. And at the last, I thank a big thank to the Dr. Madhulika Tiwari ma'am for beautiful coordination of this session 4. So here I declare that our fourth session is completed. Thank you, all of you.
Thank you. Thank you, sir.
Yes, sir.
Thank you, sir. Thank you.
Thank you, sir.
Thank you, sir. Thank you. Thank you.
Thank you. Thank you. Now, I request Dr. Sonia madam to start with the fifth session.
Yes.
Sonia madam, over to you.
Yes. Good afternoon, everyone. After the wonderful completion of our fourth session, let's head on to our fifth session. Dr. Nilesh Rajmani sir and Dr. Swati Ugade ma'am is our session coordinator. I would like to introduce our first session coordinator, Dr. Nilesh Rajmani sir. Dr. Nilesh Rajmani sir is Associate Professor in Agattantra Department at Late Kedari Redekar Ayurved Mahavidyalay, Gadinglaj, Kolhapur. He has more than 10 plus years of academic experience. Sir has published the book named Pathya Kalpana. Sir has published so many articles and papers in national and international journals. For our fifth session, our second session coordinator, Dr. Swati Ugade ma'am. Dr. Swati Ugade ma'am is Associate Professor in Dravyagun Department at Swami Vivekananda Ayurved Medical College, Pargaon, District Ahmednagar. Ma'am has more than 6 plus years of academic experience. Ma'am is pursuing PhD in Dravyaguna. Ma'am has published so many articles in national and international seminars. So I request both the session coordinator, sir and ma'am, please continue the session.
Thank you, Sonia ma'am. Now I am moving towards the final session of this fourth national conference on evidence-based Ayurveda organized by Ayurveda Teachers Association. As we know, since last 2 years, we are having the pandemic, which is COVID. In this pandemic, the most affected system is the respiratory system. So for today's last session, the topic is fundamental approach in the therapeutics of respiratory diseases. So for this, I welcome the speaker, sir, chairman and co-chairman, and I will hand over the dais to my colleague to introduce the chairperson for today's session.
Thank you, Dr. Rajmani sir. Good afternoon, all of you. I, Dr. Swati Ugade, going to introduce the chairperson of the session, Honorable Dr. Vaishali Kuchewar ma'am. It's my pleasure to introduce Dr. Kuchewar ma'am. Madam is currently working as the Dean in MG Ayurved College, Wardha. Ma'am has completed BAMS and MD Kai Chikitsa from Nagpur University in 1995 and 2001 respectively. Ma'am has also completed MPhil and PhD in health profession education from Datta Meghe Institute of Medical Sciences, deemed University, Wardha. Ma'am has guided 12 PG students and 3 PhD students. She has 20 years of clinical experience and successfully treated various cases such as AVN, chronic pancreatitis, CRF, etc. Ma'am has published more than 36 papers in Scopus and PubMed indexed journals. Ma'am has completed 4 clinical research projects on diabetes mellitus, dyslipidemia, thrombosis, and oxidative stress. She has received 10 copyrights and granted 1 patent. Ma'am has received Best Teacher Award for year 2011-12 and also Best Paper Presentation Award at 5th International Ayurveda Research Day Conference. Ma'am has participated in many national and international conferences as guest speaker, also presented many papers and posters. Now, I request Dr. Rajmane sir to introduce the co-chairpersons of the session. Over to you, sir. Dr. Rajmane sir.
Okay, thank you, ma'am. For our last session, we have first co-chairperson, that is Dr. Sujata Shamkuvar, ma'am, who is Assistant Professor at Department of Prasuti Tantra at Government Ayurveda College, Jabalpur, MP. Ma'am has completed her UG from Nagpur University and PG from Ashtanga Ayurveda College, Pune. Ma'am has clinical experience of 18 years and teaching experience of 14 years. Ma'am is member of BOS MP MSU Jabalpur. Ma'am is working on project Garbha Samskar, which is conducted by the MP government in collaboration with Government Medical College, Jabalpur. Ma'am has been felicitated as a Ayurveda Alankar by BJP Chikitsa Prakoshta, Jabalpur, and Corona Yuddha Seva Sanman by respected CM Shivraj Singh Chauhan. And for our this session, we have second co-chairperson, that is Dr. Santosh Girbide sir. Sir has completed his BMS and MD from Government Ayurveda College, Nanded, Maharashtra. Sir has completed his MD in subject Rog Nidan and Vikruti Vignan. Presently, sir is professor and HOD at Department of Rog Nidana Vikruti Vignan, R.A. Poddar Ayurveda College, Waradi, Mumbai. Sir has clinical experience of 22 years and UG teaching experience of 19 years, PG teaching experience of 15 years, and PhD teaching experience of 5 years. Sir has guided more than 15 postgraduate students in Rog Nidana, published more than 30 research articles in various journals. Sir is coordinator of National Seminar Pranavah Shrotas. Sir has received Best Teacher Award by Yashwant Shikshan Prasarak Mandal, Kodoli. And in added to that, Sir has a special duty since 2019. Sir is working as an exam coordinator and OSD at State CET Cell, Mumbai, Maharashtra for UG and PG admissions for medical, Ayush and allied faculties. Now I will request to Dr. Sujata ma'am to introduce our eminent speaker, Dr. Srivastav sir.
Am I audible, sir?
Yes, ma'am.
Okay, thank you, sir. Good afternoon, one and all. I am Dr. Sujata Shamkwar, Assistant Professor in the Department of Prasuti Tantra and Sri Roga, Government Ayurveda College, Jabalpur. I welcome you on the behalf of Ayurveda Teachers Association. At the onset, I would like to congratulate the team for organizing this 4th National Conference on Evidence-Based Ayurveda, accredited by MUHS Nashik. I would like to extend my gratitude towards Dr. Manoj Chaudhary sir for inviting me. Today, we are very fortunate to have eminent personality like Dr. Shirish Srivastav sir, Head of the Department, Swastha Vritta, Government Ayurveda College, Indore, Madhya Pradesh. Sir obtained his BMS in 1997 from Government Ayurveda College, Indore, and MD in Kai Chikitsa from MMM State Ayurveda College, Udaipur in 2001. From 2004 to 2009, he worked as visiting lecturer and from 2010 as a regular faculty in the Department of Swastha Vritta at GSC Indore. He is conducting awareness programs and lectures on healthy living since last 19 years in various industrial organizations, schools, colleges, police training schools. Additionally, he has contributed to more than 70 health-related programs on All India Radio and webinars. Today's topic is fundamental approach in the therapeutics of respiratory diseases. Sometimes respiratory disorders may become fatal, so we can't ignore it. I request to Dr. Shirish Srivastav sir to throw more light on this topic. So over to you, sir. Before starting the session, I request all the participants, please mute your mic. And if you have any query, please put it in the chat box. Question answer session will be conducted by Dr. Nilesh sir. Thank you. Hello.
Hello.
Okay, yes.
Dr. Shirish sir.
Yes.
Am I audible?
Yes, sir.
So, okay, I'm sharing the screen right now. Okay, can you see the screen?
Yes, sir.
Okay.
Yes, sir.
Yes.
Okay. Good afternoon, everyone. And thank you so much, Dr. Sujata Madam, for giving my introduction. And first of all, I would like to extend my greetings to the President of All India Teacher Association, Dr. Suryavanshi ji, for organizing such a very good seminar. And also extend my greetings to the coordinator, chairperson, and co-chairperson, and all the delegates who have appeared on today. Thank you so much, sir. So we will start with our topic. It is on the fundamental approach in the therapeutics of respiratory diseases. I have set up the window here. Just one minute. So, as we know that the respiratory conditions are now very common in all the age group or economic classes and working group. But what my observation is that even we have seen a very bad time in last 2 years with COVID-19, and importantly, we all know that the infectious condition and the allergies are very common in economically good people. So we will discuss more on these issues, that why these are common, right from the data as suggested. The chronic respiratory condition accounts for a massive health burden in India. Around 93 million, out of which nearly 37 million are asthmatic. Now, India contributes to almost 11.1% of the global asthmatic burden, accounts for the or over 42% related death, making it the asthma capital of the world. Now, we already are diabetic capital of the world. So we have more asthma patient also. Another thing, now the COPD is an invisible epidemic. Almost 15 million people are diagnosed with COPD, and another 15 million have never been diagnosed. And importantly, the third most killer after cardiac disease is and cancer is the COPD. So these are the data that definitely gain the attention for the physician. Now, in my presentation, I will discuss modern view just to tell that the Ayurveda fundamentals are more relevant. And in my lineup of the presentation, I will discuss the perception on Swash Rog and Kas Rog, the diagnostic in present context, few case studies, 4-5 case studies, and the seasonal respiratory condition, plus challenges in managing the chronic respiratory cases with Ayurveda. So we will start, as we know that when the cause of disease are same, जो भी पहले कारण थे आज भी वही कारण है बीमारियों के। द मैनिफेस्टेशंस आर सेम, द सिम्टम्स एंड साइंस आर सेम, जो पहले थे वही आज मिलते हैं, एंड प्रोग्नोसिस भी वही है। आज भी हम देखते हैं जो बीमारियां हमारे यहाँ अगर लिखिए कि याप पे या असाध्य, तो ज्यादातर उनमें से वही स्थिति। देन द प्रिवेंटिव मेजर्स एंड द थेरापेटिक्स आर टू बी सेम। वी विल स्टार्ट विथ द निदान एट फर्स्ट। अब इसमें आमतौर पे हम लोग जितने पूरे निदान देखते हैं, जरूरी नहीं है कि किसी भी बीमारी में, किसी भी व्याधि में सारे निदान मिल जाएं। मैं जिनकी बात कर रहा हूँ, जो भी एक अच्छे इकोनॉमिक स्टेटस से रहने वाले, जो आजकल आईटी इंडस्ट्री में काम करने वाले पेशेंट हमारे पास आते हैं, लगभग 19 साल से प्रैक्टिस कर रहा हूँ, तो उनमें क्या क्या निदान मिलते हैं उस पर बात करेंगे। साथ ही वात कफज क्यों बताया गया हिक्का श्वास को, इस पर भी बात करेंगे। तो जो आमतौर पे इकोनॉमिकली हेल्दी जो लोग रहते हैं उनमें क्यों हो रहा है, तो रजसा धूम वाताभ्याम की जब हम बात करते हैं, तो आज कोई भी ऐसा बहुत कम होंगे जो आईटी इंडस्ट्री में काम कर रहे हैं कि जिनको एक्सपोजर होता होगा ज्यादा इस तरह का। वहां किस तरह का एक्सपोजर होगा, शीत स्थाना अंबु सेवनाथ। ज्यादातर वो लोग जो कंडीशंस में रहते हैं, घर में एसी होगा, ऑफिस में एसी होगा, ईयर रहेगा, ड्राई एंड कोल्ड एटमॉस्फेयर, साथ ही ठंडे पानी का भी सेवन करते हैं। व्यायाम को लेकर अगर हम टीनेजर की बात करें, क्योंकि यही केसेस ज्यादा आ रहे हैं, ओल्ड एज जो आ रहा है वो काफी सेटल है, पर नए जो आ रहे हैं टीनेजर्स या मिडिल एज के लोग, उनमें ये कि व्यायाम अधिक करना, पर व्यायाम अधिक नहीं करना, गलत समय पे व्यायाम करना, रुक्ष अन्नपान, अन्न विषमाशनम, रुक्ष अन्न का ज्यादा सेवन करना। कई लोगों में आजकल, नए लोगों में आ गया है कि भाई घी तेल नहीं खाना, तो रुक्ष अन्न, कॉफी का सेवन बहुत ज्यादा हो रहा है, चाय या कॉफी का। आप देखने में आता है कि आजकल बड़े बड़े शहरों में इसके स्टॉल्स रहते हैं। इसके अलावा आनाह, आनाह, आनाह के कारण भी रुक्षता हो रही है, तो आनाह भी बहुत कॉमन मिल रहा है। तो अब हिक्का श्वास के निदान में भी आनाह बताया, ठीक है। इसके अलावा ज्वर प्रतिशाय भी इसका कारण हो सकता है, पांडु भी हो सकता है। एक और इसमें जो निदान जो कॉमनली देखने में आता है जब हिस्ट्री लेते हैं पेशेंट की, कि जल आनुपपिष्टम दध्यात आमशीर, दही किसी भी समय खाते हैं। हमारे यहाँ दही खाने का भी एक विधान बताया है, शाम को भी दही ले लेते हैं, उसके साथ नमक भी ले लेते हैं और कच्चा दूध भी लेते हैं, ठीक। तो ये निदान आमतौर पे देखने में मिलते हैं। जैसा मैंने पहले बताया कि हमारे निदान वही है, इसके अलावा निदान देखने में नहीं आते। और साथ ही हम ये भी देख रहे हैं कि हिक्का श्वास में जब हम बात करते हैं तो उनके पूर्व रूप की बात करते हैं, तो पूर्व रूप में आनाह पार्श्व च पीड़नम हृदय से। अब आनाह पूर्व रूप में बताया है, सुश्रुत में भी आनाह बताया है, लगभग यही लक्षण दिए हैं, ठीक है। तो हमको पूर्व रूप की जरूरत क्या है ज्यादा देखने की। जैसे हम बताते हैं कि रूप के पहले जब पूर्व रूप को हम, अगर पूर्व रूप अवस्था में पेशेंट आता नहीं हमारे पास, आमतौर पे आता है रूप अवस्था में, तो जब पेशेंट आता है तो निदान में भी आनाह बताया है और उसके कारण रुक्षता भी बताई है। तो हमको जब चिकित्सा करते हैं तो आनाह को सेटल करना आवश्यक है, नहीं तो निदान और पूर्व रूप रहेगा तो कहीं ना कहीं व्याधि और ज्यादा पोटेंशिएट होती है। तो इसका पूर्व रूप बताने का मुख्य उद्देश्य यही है कि हम पूर्व रूपों को रूप आने के पश्चात भी देखें, क्योंकि निदान सेवन अगर हो रहा होगा तो वापिस से कहीं ना कहीं व्याधि बढ़ने की संभावना रहती है। अब संप्राप्ति पे हम विशेष नहीं जाएंगे, सामान्य संप्राप्ति भी दी गई है इसमें कि वायु मारुत प्राणवाहिनी स्रोतांश विषय मुक्त्यंती। तो ये तो हम जानते हैं। विशेष संप्राप्ति में बताया गया है, यदा स्रोतांशी समृद्ध मारुत कफ पूर्वत, वायु और कफ साथ में कुपित होकर और अवरोध करते हैं। अब श्वास के भेद में एक, क्योंकि हम पढ़ाते हैं बच्चों को, तब भी ये विवाद बच्चे पूछते हैं कि आखिर श्वास में दोषज भेद क्यों नहीं दी गए। श्वास और हिक्का में का वर्णन दोष भेद से नहीं दिया गया है, क्योंकि कफ वात निदान मुख्य रूप से बताया गया है और स्वतंत्र रूप से कोप होता है। जैसे वात व्याधि में मुख्य रूप से वात की दृष्टि होती है, एक अपवाद स्वरूप गद्रसी है जहाँ वात कफ की दृष्टि होती है। तो यहाँ भी क्या होता है, अनुगत अवस्था में पित्त मिल सकता है वात या कफ के साथ, उसका रेफरेंस पथ्य के वर्णन में दिया गया है। जैसे सुवर चलो रस दुग्धम रतम त्रिकटु आन्वितम शाल्योदनम स्यापानम वात पित्त अनुगत हितम। तो अनुगत अवस्था में पित्त आएगा, पर आज के समय में हम देखते हैं कि पित्त अधिक मिलता है श्वास के रोगियों में, क्योंकि हमारे आहार ऐसे हो गए, हमारा जो लाइफ स्टाइल है, दिनचर्या है, वो बिगड़ गई है। तो कहीं ना कहीं वात पित्त भी दूषित हो रहा है, पित्त भी दूषित हो रहा है। पेस्टिसाइड, प्रिजर्वेटिव या एक्सटेंडेड स्लीप पैटर्न जो रहता है, उससे पित्त की भी दुष्टि होती है। तो इस चीज का ध्यान रखना। और पित्त वर्णन दिया गया है, उसके रेफरेंस ये भी है, न स्वेद्या पित्त वहां। तो अगर पित्त ज्यादा बड़ा है तो वहां स्वेदन नहीं करना चाहिए, ठीक है। तो ये हमें रेफरेंस मिलते हैं। तो श्वास के भेद, वात कफ अजित, क्योंकि निदान में भी वात कफ अधिक दिया हुआ है, 5 प्रकार के भेद दिए हैं, जो कि 3 असाध्य है, 1 याप्य और 1 का औषधि की भी आवश्यकता नहीं पड़ती है ज्यादा। अब चिकित्सा जो दी गई है उसमें आमतौर पे हम लोग पेशेंट को कम कराते हैं, पर इसका बहुत ज्यादा लाभ है। इक्का श्वासादितम स्निग्ध और आदो स्वेदा अपचरित आत्म लवणम तेन नाड़ी संकल्प। अब इसमें आमतौर पे जो अप्रोच लेते हैं हम लोग कि उसकी पूरा भाग पे हम मालिश करते हैं सेंधवादी तेल की, और नाड़ी स्वेद करते हैं, या कपड़े से स्वेद करते हैं, वृक्ष स्वेद भी कर सकते हैं। पर हम लोग जब अप्रोच करते हैं, हमारे क्लिनिकल प्रैक्टिस में हम उसको बताते हैं कि पेट की भी मालिश करो और पृष्ठ की भी मालिश करो, दोनों चीजें आवश्यक है। पृष्ठ की मालिश करने से अनुलोमन अच्छा होता है। और चूंकि हम जानते हैं वी आर एब्डोमिनोथोरेसिक ब्रीदर, हम लोग थोरेसिक ब्रीदर नहीं है, तो हमारा पेट भी अच्छा होना चाहिए। जैसे निदान में पूर्व रूप में भी देखा आना है, तो आना या आधमान जब तक नहीं ठीक होगा, हमारा ब्रीदिंग का जो ईज है वो नहीं आ पाता है। तो इस चीज का ध्यान रखना चाहिए कि हमें संपूर्ण या तो स्नेहन स्वेदन करें, या मुख्य रूप से कोष्ठगत पूरा में करें। इसके बाद स्नेहन स्वेदन के बाद वमन कराना है। ये बहुत ही एक इम्पॉर्टेंट चीज है कि श्लेष्मणि समृद्धे वमनम पाए। जब बहुत बड़ा हुआ है, अगर कफ बड़ा हुआ है, तो वहां पर हमको वमन कराना है। थोड़ा सा मेरे इसमें क्या हो रहा है, आपकी विंडो आ रही है तो हाइड हो रहा है मेरे स्लाइड, थोड़ी सी स्लाइड ज्यादा वाइड है इसलिए। अब इसी का एक बहुत अच्छा सा उदाहरण दिया है नव ज्वर के, इसमें भी दिया है, नव ज्वर आमेशु वृक्ष स्वेद विणलंघनम समीक्षोल्लेघनम व अपि कार्य लवणम अंबुना। अब नव ज्वर आम दोष में वृक्ष स्वेद और लंघन है, ठीक है, कब जहां दोष कम है। पर अगर दोष अधिक है तो उल्लेखनम वापी कार्य लवणम, नमक युक्त पानी से उसका उल्लेखन कराना है। इसको अगर हम आज के भाषा में देखें तो मैं चूंकि स्वस्थ से हूं, तो कुंजल या जल धूती जिसको बोलते हैं, ये हमारे ज्वर के उसमें भी दिया हुआ है, ज्वर चिकित्सा में भी दिया हुआ है, आम दोष में, कि लघु वमन करा दें उसको तुरंत। इसका रेफरेंस है कफ प्रभानानु उत्कृष्ट दोष अगर है तो उसको निकालना आवश्यक है, नहीं तो वही ज्वर करते हैं और वमन योग्य है तो उसको वमन करा दें तुरंत, तो उसकी व्याधि जल्दी ठीक होगी। अब क्योंकि चिकित्सा की बात चल रही है, तो श्वास में क्षार का उपयोग के बारे में बात करते हैं। क्षार हम लोग कई बार जितने भी कन्वेंशनल मोड रहते हैं ना, जैसे जब चिकित्सा करते हैं तो हमको जो भी रेफरेंसेस रहते हैं, जरूरी नहीं कि वो सारी औषधियां मिल जाएं, इसलिए चिकित्सक को चाहिए कि वो अपने पास से कुछ औषधियों का निर्माण करे। और चरक संहिता, खासतौर से चिकित्सा स्थान एक बहुत अच्छा प्लेटफॉर्म है कंपोजिशन को कैसे समझना, कैसे बनाना। तो क्षार चाप्यम अश्वगंधाया, अब अश्वगंधा और अन्य मयूर पादनाल और अन्य प्रकार के द्रव्यों से क्षार बनाना है। अब क्षार करता क्या है? क्षार जो भी कफ समृद्ध गति प्राण प्रकोपजा, अब जो भी कफ के द्वारा प्राणवायु की गति अवरुद्ध हुई और प्राण में प्राणवायु दूषित हुई है, तो जो क्षार होता है वो जितने भी इन्फ्लेमेटरी प्रोडक्ट आपके स्रोतस में बन रहे हैं, इन्फ्लेमेटरी प्रोडक्ट्स आर एसिडिक, तो क्षार जो होता है उसका पाक करता है, और क्षार पाक करके उनको जो भी मल पक्व हो जाते हैं या दोष पक्व हो जाते हैं, तो स्वतः स्रोतो अभिमुख होके बाहर निकल जाते हैं, ठीक है। इवन अगर आप स्पाज्म की भी बात करें, अगर हम बात करें कि स्पाज्म भी आ रहे हैं, तो वहां भी क्षार काम कर सकता है। ठीक है, हमको इसको क्षार को देने के लिए आवश्यक है उन्हें लेह बना के देना है, उसको डायरेक्ट नहीं देना है, क्योंकि वो एक कोरोसिव होते हैं क्षार, ज्यादा समय तक देने से नुकसान भी कर सकते हैं, तो लेह के रूप में देना है। ठीक है, एक और रेफरेंस आता है कासिने छर्दनम दद्यात् स्वरभंगे च बुद्धिमान, मतलब अगर श्वास के रोग में कास भी हो रहा है और स्वरभंग भी है, तो उसको वमन कराना चाहिए। अब एक ये फ्रेज बहुत कॉमन है, वात श्लेष मरे युक्तम तम केतु विरेचनम, पर हम लोग इस चीज में कई बार पूर्ण विरेचन को भी ले लेते हैं, कई बार इसको वमन विरेचन से भी लेते हैं। पर मैंने अपनी प्रैक्टिस में देखा है कि हमको वात श्लेष मर द्रव्य कौन से, चंद्रशूल है, शटी है, सौंफ है, अजवाइन है, निशोत, हरड़ है, ये ऐसे द्रव्य हैं कि जिनको लगातार भी दिया जा सकता है, अल्प मात्रा में भी दिया जा सकता है, और नुकसान भी नहीं होता है इनसे, अगर सही समय पे दिया जाए तो इनका उपयोग किया जा सकता है। संप्राप्ति घटक की बात करते हैं अगर हम, तो पित्त स्थान समुद्भव के बारे में, तो अधिष्ठान जो है आमाशय भी बताया, आमाशय का भी जो भाग है वो पित्त का स्थान रहता है। तो दोष मुख्य रूप से वात कफ, जैसा हमने देखा निदान भी वात कफ है, पूर्व रूप में भी वात की स्थिति बनती है, लक्षणों में भी वात कफ की। दूष्य रस धातु प्राणवायु है, स्रोतस लक्षण स्रोत दुष्टि लक्षण संग तथा विमार्ग गमन है, और अग्निमांद होता है, कच्छ साध्य होता है आमतौर। अब जब हम श्वास चिकित्सा में और आगे जाते हैं, क्योंकि मैं चिकित्सा करता हूं और एनालिटिकली अगर हम युक्ति की बात करें, हम एनालिटिकल अगर होकर काम करते हैं, तो हमें कम औषधियों से भी अच्छा रिजल्ट मिलता है। तो इसमें जब हम कफ वातक में उष्णम वात अनुलोमम, ये एक रेफरेंस आता है। उसके बाद हम देखते हैं कि शटी कपूर काचरी का उपयोग बहुत अच्छा बताया गया, पुष्कर मूल कपूर काचरी, शट्यादि योग शट्यादि चूर्ण का उपयोग बताया गया चरक चिकित्सा स्थान में। तामलकी कासर और श्वासर महाकषाय में भी दिया है, भूई आंवला। पर कपूर काचरी में और भी अन्य द्रव्य, कई बार हमें कुछ द्रव्य मिलते नहीं, यहाँ पिपली उष्ण हो जाता है, नागरमोथा फिर भी, या तुलसी बीज भी, कई बार ये औषधियाँ उष्ण अधिक हो जाती हैं। जैसा मैंने शुरू में बताया कि आज के समय में हमारे एसिडिक मीडिया बहुत ज्यादा रहता है, पित्त की अधिकता रहती है, तो हमें औषधि देते समय सावधानी रखना चाहिए कि वो पित्त कुपित ना हो। तो कपूर काचरी का प्रयोग जो है वो बहुत फायदा करता है श्वास के रोगियों में, खास तौर से कफ के आवरण को, कफ के अवरोध को दूर करने के लिए। अब हम कास की बात करते, 2 मिनट में हम इसकी बात करके कुछ केस स्टडीज पे बात करेंगे। अब कास और श्वास की संप्राप्ति भी कहीं ना कहीं एक, जब हम क्लिनिकली देखते हैं तो श्वास और कास 2 ही पेशेंट आते हैं हमारे। पेशेंट जो आता है बोलता है मुझे श्वास भी है कास भी है, ठीक है। तो हमको श्वास के रोगियों में भी कास मिलता है, और कफज कास में भी संप्राप्ति बनती है, बहुत कुछ हद तक श्वास जैसी भी देखने में आती है। तो यहाँ भी वही है, अपान वायु ऊर्ध्व होती है, और ऊर्ध्व होकर वो अपान वायु उरा भाग में जाके, ऊर्ध्व भाग में जाके दोषों को कुपित करती है, और शुष्क व कास युक्त कफ युक्त कास को करती है। मैं संप्राप्ति में बहुत ज्यादा नहीं जा रहा हूँ। साथ ही हम जब एग्जामिनेशन की बात करते हैं पेशेंट की, तो जहां जहां भी प्रतिघात होता है, जहां भी उस स्थान विशेष में कोई भी प्रतिघात होता है, तो वहां वेदना व शब्द का विशिष्ट मिलता है। अब वातिक कास की हम बात करते हैं। हम निदान पे नहीं जाते क्योंकि मुझे लगता है हम लोग टाइम शायद लगेगा हमें। तो जब लक्षण देखते हैं तो उसमें बहुत बहुत स्पेसिफिक लक्षण दिए, निर्घोष देन स्ततनम दौर्बल्यम शोभ मोह कृतम। अब कहीं जगह निर्घोष होगा, कहीं जगह आवाज नहीं आएगी, और कहीं जगह स्ततनम मतलब कि रेजोनेंट साउंड आएगा। अब हम जानते हैं कि कहीं जगह डलनेस आती है साउंड में, कहीं जगह हाइपर रेजोनेंट रहता है, ठीक है। और इसकी चिकित्सा, इसकी जो कहना चाहिए कि थेरापेटिक जो डायग्नोसिक बताया गया है कि स्निग्ध आम्ल लवण उष्ण भुक्तम पीते प्रशाम्यति, मतलब स्निग्ध अम्ल। अब आप देखिए, हम लोग जब भी कोई श्वास कास का रोगी आता है तो कई बार हम उसको अम्ल लवण रस का निषेध करते हैं। आमतौर पे होता है पेशेंट आता है हम खट्टी चीजें नहीं खाना, पर वातिक कास के पेशेंट में हमको स्निग्ध अम्ल देना है। वो कैसे देना है, बहुत आसान तरीका है उसका। उसके लिए हम कुछ महाकषायों पे देखेंगे अभी कि चरक में महाकषाय दिए हैं, वहाँ अम्ल रस का प्रयोग बताया गया है इसमें। तो ये एक स्निग्ध अम्ल का उपयोग हमको करना चाहिए लक्षण के अनुसार। जो भी हमारे रोगी जब लक्षण देता है तो उसके अनुसार किया जा सकता है। आमतौर पर स्निग्ध अम्ल हम निषेध करते हैं। इसी तरह से पित्तजकास में भी बहुत स्पष्ट लक्षण दिया है कि श्लेष्मणा नाम पित्त संसृष्टम, जो कफ निकलेगा पित्त संश्लिष्ट होगा वो, ठीक है, पीले से रंग का आएगा, ठीक है, दाह होगा, उसमें तिक्तास्यता होगी, तृष्णा होगी। तो ये लक्षण से हम पित्त कास को समझ सकते हैं। इसी तरह से कफज कास में बहुल मधुर स्निग्धम और घन कफ आएगा, बहुत सारा आएगा, घन आएगा, सॉलिड आएगा, मधुर आएगा। अब ये बात तो है कि आमतौर पे हम बहुत डिस्टिंक्शन कर नहीं पाते, क्योंकि पेशेंट उस समय बताता है, कई बार सही नहीं बता पाता। पर एक सरल सा तरीका, पेशेंट जब भी आता है तो उससे पूछना चाहिए कि लाला स्त्राव कैसा हो रहा है, अग्नि की स्थिति पता करने के लिए। साथ ही जब वो कफ स्टीवन कर रहा है तो पतला हो रहा है, गाढ़ा हो रहा है। इसके अलावा पूछना चाहिए जब वो थूक रहा है तो वो थूक रहा है, मतलब वो आसानी से थूक पा रहा है, सेपरेट हो रहा है कि नहीं, मुंह से दूर गिर रहा है या कपड़ों पे गिर जाता है। अगर वो कपड़ों पे गिर रहा है, चिकना ज्यादा है, आम है इसका मतलब, और वो स्पष्ट रूप से थूक पा रहा है, दूर गिर रहा है, तो वो निराम है। इस तरह से हम लोग को हिस्ट्री टेकिंग में ध्यान रखना चाहिए। तो हमें ये पता लग जाता है कि जीर्ण है या नया नया है, क्योंकि नया होगा तो उसमें आम की स्थिति बनती है। अब कास की चिकित्सा में, मुझे पित्त चिकित्सा में, पित्तज कास की चिकित्सा का मैंने एक रेफरेंस लिया है। देखिए, मैं रेफरेंस इसलिए शेयर कर रहा हूँ कि रेफरेंसेस जो रहते हैं वो फिक्स रहते हैं, और उसमें इंटरप्रिटेशन आपके अपने रहते हैं और वो बहुत ओरिजिनल रहते हैं। उसको आप इंटरप्रेट भी कर सकते हैं और वो आपका ओपिनियन बन जाता है, उसी को हम आगे कैरी ऑन करते हैं। तो पित्ते तनु कफे कास त्रिव्रतम मधुर युक्त। अब कफ पतला आ रहा है कास में, तो तीव्रत निशोत में जो भी औषधियां बता रहा हूँ ये कहीं ना कहीं मेरे पेन पे रहती हैं और इनका कंपोजिशन भी करते हैं। तो तीव्रत निशोत का उपयोग करना है मधुर द्रव्यों के साथ। और दध्य घन कफे, जब घन कफ होगा तो तिक्तेर विरेचन, तो उसमें तिक्त औषधियों का प्रयोग करना है। अब ये जो रेफरेंस है, मैं बताऊँ, हम लोग को कई बार हम जब रेफरेंस देखते हैं तो जरूरी नहीं है कि आपको वो उसी चैप्टर में मिले। अब मैं आपको ये तनु कफ कासे तीव्रतम मधुर विताम का जो रेफरेंस बता रहा हूँ, ये एक जगह और हो सकता है यूज, जब हम अम्लोदगार की बात करते हैं और अविपत्तिकर चूर्ण की बात करते हैं। अविपत्तिकर चूर्ण में भी तीव्रत है, मिश्री भी है, संभाग है, और हमको निशोत वहीं देना है। हम कई बार निशोत को रुक्ष अवस्था में देने की कोशिश करते हैं। हमको सुदर्शन घनवटी को रुक्ष में नहीं दे पाएंगे, वहां पे हमको रुक्षता पहले से होगी तो हम वो फर्दर रुक्ष करेंगे। तो तीव्रत भी रुक्ष है, तिक्त रस, उष्ण भी मधु, कटु विपाक। तो इसलिए हमको पित्त भी जो द्रवता हो, सस्नेहम द्रव अवलम सरम कटु, तो सस्नेहम द्रव, जहाँ पित्त की यह अवस्था हो, दोषों के गुण को ज्यादा देखना चाहिए, केवल दोषों की गुणवत्ता देखने के साथ साथ दोषों के गुण को देख, तो वहां पे वो बहुत एक्यूरेटली काम करता है। ठीक है, तो ये एक बहुत अच्छा रेफरेंस है। इसके अलावा पैत्तिक कास में हमको सीता का भी आता है, द्राक्षा भी आता है। आमतौर पे हम मीठा बंद कर देते हैं कि हमेशा सोचते हैं कि कुछ न कुछ हम रोगी को, आमतौर पे चलन में भी ये रहता है कि उष्ण चीजें देना है, पर अनुपान के रूप में भी दिया जा सकता है। इसी प्रकार से और भी जगह शर्करा, सीता, विदारी में, मेरी प्रैक्टिस में विदारी का उपयोग भी बहुत अच्छे से होता है श्वास के रोगियों में, खासतौर से पित्त जहां बड़ा रहता है। शतावरी का उपयोग भी बहुत अच्छे से, अपन वो रेफरेंस भी देखेंगे आगे से। सो वी नीड टू रेमिफाई द रेफरेंसेस। ये रेफरेंसेस जितने थे ये डेड एंड नहीं है, दे आर दी ओपनिंग टू ब्रांचिंग ऑफ द कंसेप्ट। नाउ वी विल सी सम ड्रग्स फ्रॉम कासर महाकषाय, स्वाशर महाकषाय, है ना। कई बार हमको उस जगह रेफरेंस मिलते नहीं है जैसा हम देखने की कोशिश करते हैं। अब हमको कई बार जब हम चिकित्सा स्थान पढ़ते तो ऐसा लगता है कि जब स्कूल में थे, कॉलेज में थे, यूजी में थे, तो लगता था कि सूत्र स्थान शायद इतना आवश्यक नहीं, पर अब ऐसा लगता है कि सूत्र स्थान ज्यादा आवश्यक है। क्योंकि महाकषाय को आप कैसे एनालाइज करें, क्या जो महाकषाय दिए इनमें मान लीजिए मैं हिक्का निग्रहण मात्र है, तो ये हिक्का के लिए इनफ है, इतना ही सफिशिएंट है, या कास है तो सभी कास इससे हो जाएंगे, या जो साध्य है वो सब इससे हो जाएंगी। ये उन्होंने पॉसिबल द्रव्य दिए हैं, इनके परम्यूटेशन कॉम्बिनेशन हमको बनाने हैं, इनको रेमिफाई हमको करना है। जैसे अगर अपन बात करें कि कांसर महाकषाय और श्वासर महाकषाय, इसमें कुछ चीजें जैसे ताम्लक ही हुई आंवला कॉमन सा दिया हुआ है, फिर हिक्का और श्वास जो साथ में वर्णन है चरक में, उसमें शटी पुष्कर मूल दिया हुआ है। ठीक है, इसी तरह से आपके पास जब रोगी आता है, हम बहुत डिस्टिंक्टिवली नहीं करना चाहिए। आप जरूरी नहीं है कि कोई श्वास का रोगी आया तो बिल्कुल एक्सक्लूसिवली श्वास ही है उसको ज्वर भी हो सकता है, उसको थकान भी हो सकती है, उसको अंगमर्द भी हो सकता है। तो जब कंपोजिशन करेंगे तो आपको कई सारी औषधि या औषधि के कंपोजिशन याद रहना चाहिए। अब आप यहाँ पे देखिए कि ज्वर हर हमको कुछ देना है, तो सारिवा भी दिया, मजीठ भी दिया है, पाठा भी दिया है। ठीक है, परुषक, अभया, अमल की विविध, त्रिफला। अब ये चीजें हम आमतौर पे आयुर्वेद में प्रचलन में है कि रक्त शोधन बहुत ज्यादा होता है, पर रक्त शोधन महाकषाय कहीं नहीं है। ज्वरहर है, ये रक्त शोधन कर रहा है। ठीक है, इसी तरह से श्रमहर महाकषाय, जब आपके पास पेशेंट आता है श्वास का, उसके अंदर दीनता होती है, दीनता एक लक्षण भी आया है। ठीक है, थकान बनी रहती है। ठीक है, एसिडिक मीडिया पूरे में आ जाता है। तो कुछ फल देने की बात कही है, द्राक्षा, खजूर, प्रियाल, बदर, दाड़िम, फल्गु। ठीक है, ये फल जो है, मोस्ट ऑफ द फ्रूट्स आर एसिडिक, अल्कलाइन इन नेचर। इवन जो आपका लेमन रहता है वो भी अल्कलाइन ही होता है, क्योंकि उसमें मिनरल्स होते हैं। तो फाइनल प्रोडक्ट बनता है इन फलों का, वो अल्कलाइन बनता है। तो श्रम में क्या होता है कि हमारे थक इसलिए जाते हैं हम कि कहीं ना कहीं हमारे अंदर एसिड की मात्रा बढ़ जाती है, आम बढ़ जाता है। किसी विशेष परिस्थितियों में भी थक जाते हैं, जब तनाव में रहते हैं या मेघाच्छादन में भी हम जल्दी थक जाते हैं। अगेन वही कि हमारा आम होता है, हमारा जो रेस्पिरेशन रहता है पूरा नहीं हो पाता, तो एसिड ज्यादा बनता है। तो जितने भी रहते हैं, इवन नारियल भी बहुत अच्छा अल्कलाइन है। अगेन अब जब हम बात करते हैं कि या तो रेस्पिरेटरी एलर्जीज की बात करें या स्किन पे भी कुछ हो रही है, तो हम कंठ महाकषाय लें, या स्किन के बारे में बात करें तो विषय या उदर्द प्रशमन महाकषाय लें, कंडुग्न महाकषाय लें। ये सारे आपके स्किन एलर्जी पे भी काम करते हैं। साथ ही विषग्न महाकषाय रेस्पिरेटरी जितनी एलर्जीज होती है उसमें भी बहुत अच्छे से काम करता है। So we will discuss few cases here, but I must tell that we must be liberal enough to change our prescription to one epigram. आपको जब भी लगता है कि आप रिजल्ट नहीं दे पा रहे, आप तुरंत अपने आप को बदलने की कोशिश करें। I will not share single prescription here, क्योंकि हम जो मेडिसिन है वो बहुत समय तक देते हैं। एक पेशेंट हमारे कई बार 2-2 साल तक चलता है, वो ठीक हो जाता है, फिर भी हम बोलते हैं कि दवाई लेते रहो, बीच बीच में सिम्टम बढ़ते हैं। सिंगल प्रिस्क्रिप्शन शेयर करना, मुझे लगता है कि वो कहीं ना कहीं फैब्रिकेशन आते हैं, उसमें फैब्रिकेटेड रहता है। ठीक है, सो इन आवर प्रैक्टिस वी ऑफर रिक्वायर्ड चेंजेस इन प्रिस्क्रिप्शन कंपोजिशन एज पर द सीजनल चेंजेस एंड इंडिविजुअल रिस्पॉन्सेज, चेंज इन द मैनिफेस्टेशन। कई बार बीमारी भी चेंज होती है अपनी। तो मुझे ध्यान है जब कई बार पंचकर्म करते हैं तो उसके बाद प्रेजेंटेशन चेंज हो जाता है, ठीक हो जाती है बहुत बार, कई बार ठीक नहीं भी होती, उसका प्रेजेंटेशन चेंज हो जाता है स्किन कंडीशन का खास तौर से। तो इन चीजों को देखते हुए इट इज डिफिकल्ट टू फ्रेम अ सिंगल प्रिस्क्रिप्शन। ठीक है, और कई बार हमको एग्जैक्ट मैनिफेस्टेशन मिलते भी नहीं है। आज के समय में जो टेक्स्ट में लिखे रहते हैं, कई बार मैनिफेस्टेशन उसके अलावा ही मिलते हैं, एडिशनल इटियोलॉजी भी मिल सकती है। ठीक है, और हमको डायग्नोसिस जब करते हैं तो हमको अग्नि दोष के गुणों को ज्यादा देखना चाहिए, आम निराम देखना है। और सीजनल चेंजेस को हमको बहुत ज्यादा देखना चाहिए, खासतौर से जैसे मैं अगर सिंगल प्रिस्क्रिप्शन दे रहा हूँ और मैंने शरद ऋतु में पित्त प्रकृति व्यक्ति को पित्तकाश में कोई चिकित्सा दी है, तो वो वसंत ऋतु में मेरे को चेंज करना पड़ेगा, उसमें डोज कम करना पड़ेगा। इसी तरह से कफज काश में वसंत ऋतु में अगर मैंने कोई प्रिस्क्रिप्शन दिया है तो शरद ऋतु में उसको मेरे को चेंज करना पड़ेगा। इसलिए सिंगल प्रिस्क्रिप्शन की बात मैं नहीं करने वाला हूँ। ठीक है, और आजकल क्या होता है कि हमारे पास जब पेशेंट आता है, मान लीजिए अस्थमा का पेशेंट आया या श्वास का पेशेंट, दूसरी कोई सी श्वास है या कास का पेशेंट आया, तो वो कई बार दवाइयाँ चल रही होती हैं और उनको हम एकदम से छोड़ने का नहीं बोल पाते हैं। उससे होता क्या है, मॉडर्न मेडिसिन के हम रेपरकशन देखेंगे कि हमें एग्जैक्ट सिम्टम नहीं मिल पाते हैं जो हम एक्सपेक्ट करते हैं, ठीक है, अल्टर्ड सिम्टम्स मिलते हैं। प्लस उस कोर्स ऑफ द ट्रीटमेंट, मॉडर्न ट्रीटमेंट में द इनहेरेंट रिस्पॉन्स ऑफ सेल्फ हीलिंग वो चेंज हो जाता है, ठीक है। तो हमको कई बार एग्जैक्ट पिक्चर भी नहीं मिल पाता, ठीक है। फंडामेंटल्स हमेशा सेम रहेंगे, बट द माइन्यूट डिफरेंसेस एंड इंटरप्रिटेशन एंड ओपिनियन विल ऑलवेज बी देयर। नाउ आई विल डिस्कस, सो हियर अभी मेरे प्रीवियस जो लेक्चर हुआ था उसमें भी इस तरह की कुछ बात हुई थी। डॉक्टर प्रताप सर ने बात कही थी कि प्रत्यक्ष बहुत कम होता है और अनुमान की त्रैकालिक भी होता है और वो सीमा रहित होता है। तो दर्शन स्पर्शन प्रश्न एक यूनिवर्सल रूल है डायग्नोसिस का, मॉडर्न साइंस में भी यही कहते हैं, इसके बाहर कोई डायग्नोसिस होता ही नहीं। तो हमको क्या लाइन ऑफ ट्रीटमेंट, लाइन ऑफ एग्जामिनेशन कैसा रहना चाहिए? पेशेंट आ रहा है, सबसे पहले आपको उसको जनरलाइज सिम्टम को देखना है, टॉप टू टो तक देखना है, जब वो चल के आ रहा है या जैसे भी आ रहा है, चाहे वो रेस्पिरेटरी केस भी है तो भी उसको आपको टॉप टू टो तक देखना है, उसकी स्किन देखना है, हेयर देखना है, आई देखना है, टंग, स्किन फोल्ड भी देखना है। स्किन फोल्ड भी अग्नि की स्थिति बताते हैं, रस धातु की स्थिति बताते हैं। आप स्किन देख के, आईज देख के भी उसके दोषों की, कौन सा दोष कुपित है ये पता कर सकते हैं, ठीक है। और जीआई मैनिफेस्टेशन देखना है कि उसका पेट कैसा है, राइट फ्रॉम अग्नि को देखना है तो उसके माउथ से लेके एनस तक की हिस्ट्री लेना है कि किस तरह का खाना खाने के बाद क्या लगता है, सलाइवेशन कैसा होता है, खाना खाने के बाद भारीपन लगता है। ये सारे रेस्पिरेटरी कंडीशंस में भी फायदा आपको जरूरी है जानना, क्योंकि आप जो भी मेडिसिन देने वाले हैं सबसे पहले वो उसका अग्नि के स्तर पे ही काम करना पड़ेगा, वात के स्तर पे ही काम करेगा। और उसके बाद मैनिफेस्टेशन टू द स्पेसिफिक डिजीज, जब वो कोई कंप्लेंट कर रहा है कि रेस्पिरेटरी डिजीज है तो उस पर हमको क्वेश्चन लेना है, दर्शन स्पर्शन प्रश्न उस पर लेना है, ठीक है। इससे बेनिफिट क्या होता है इस लाइन ऑफ एग्जामिनेशन से या क्वेश्चनर से, कि आपको एडिशनल भी कई बार कुछ डिजीज मिल सकती है, कुछ सिम्टम मिल सकते हैं जो कि वो नहीं जानता है, नहीं बताना चाहता है, और वो आपको फाइनली ट्रीटमेंट देने में हेल्प करता है। इसी के साथ हम जब इस फ्रेम में काम करते हैं तो प्रकृति का भी एग्जामिनेशन होता है। प्रकृति एग्जामिनेशन बहुत आवश्यक है। श्वास के रोगी, जीर्ण रोगी आते हैं हमारे पास कई बार, तो जब जीर्ण है तो उसमें कहीं ना कहीं प्रकृति मदद कर रही होती है। तो हमको इसमें आम निराम देखना है, लाला स्त्राव कैसा है, आगमान आटोप कैसा है, फिर साम निराम के अनुसार कफिष्ठिवन हमने बात करी थी अभी कि आम अगर कफ है तो वो कैसा होगा और निराम है तो कैसा होगा, दोष भेद आ सकते हैं उसमें, ठीक है। डोजिंग को लेके भी मेरा सोचना रहता है कि हम कई बार एज के हिसाब से दवाई लिख देते हैं कि उसकी अगर एडल्ट है तो हम ज़्यादा डोज देते हैं, पर उसकी अग्नि कैसी है उस पर हमको ज़्यादा उस हिसाब से डोजिंग करना चाहिए, ठीक है। और हमारा उद्देश्य रहना चाहिए, कोई सी भी चिकित्सा करते हैं कि अग्नि को बढ़ाना है, जो भी अग्नि कम है, और वात का जो भी कुपित हुआ है उसको स्वस्थान में वात को लाना है। अब औषध, ये तो हमने बात करी कि हम किस आधार पे पेशेंट को देख रहे हैं। अब औषधि के बारे में भी हमको थोड़ा सा एक माइंडसेट बना के रखना चाहिए। मैंने अभी पहले भी बोला था कि कई बार हम रेडी मेडिसिन के बारे में ज्यादा सोचने लगते हैं, तो औषधि की कार्मुकता के लिए भी हमको, चाहे निदान कर रहे हैं या औषध की कार्मुकता अगर हम देख रहे हैं, तो 3 प्रमाणों का उपयोग करते हैं। तो हम जब पढ़ते तो वहां लिखा रहता है प्रत्यक्ष, अनुमान, आप्तोपदेश। अब आप्तोपदेश और प्रत्यक्ष सभी करेंगे। आप्तोपदेश की बात अगर हम जब करते हैं तो सब लोग वही सुन रहे हैं, सब वही पढ़ रहे हैं, प्रत्यक्ष भी देख रहे हैं, पर एनालिसिस इसमें डिफरेंट हो सकता है। अनुमान आप्तोपदेश को भी एनक्रोच कर रहा है, प्रत्यक्ष को भी एनक्रोच करेगा, ठीक है, और इसी से आपका फाइनल आउटकम आएगा। तो जैसे मैं एग्जांपल बता रहा हूँ आपको कि गोरखमुंडी, अब गोरखमुंडी का यहाँ कहीं रेफरेंस नहीं, बट गोरखमुंडी इज रिस्पॉन्सिबल टू रिजॉल्व सटल शोथ, बहुत सूक्ष्म शोथ जो रहता है, उरह भाग, ऊर्ध्व भाग, शिरो रोग के भी सूक्ष्म शोथ को बहुत अच्छे से वो दूर करता है। फुटकी जो है वो लोअर पार्ट में जो शोथ हो रहा है, मिडिल पार्ट में जो शोथ हो रहा है उसको करता है। जौ, पुनर्नवा, सूंठ, देवदारू, सिंधव, ये पूरी बॉडी के शोथ को कम करते हैं। जौ, वाट्यमांड की अगर हम बात करें प्रमेय चिकित्सा में, मधुमेह में, तो जौ जो है, जो भी आपका लिक्विड फ्लूइड मेटाबॉलिज्म है और मिनरल मेटाबॉलिज्म है उसको रीस्टेट करने का काम बहुत अच्छे से करता है, ठीक है। और एक मेरा ऑब्जर्वेशन ये भी रहा है कि जब हम कई बार कोशिश करते हैं कि ओबेस पेशेंट का वजन कम करना है, नहीं हो पाता, पर जब आप श्वास के रोगियों को, जब ओबेस होता है और आप सामान्य यही औषधियां दे रहे हैं, जहाँ अग्निवर्धन और वात को रिस्टेट करना है, वात कफर औषधियां दे रहे हैं, तो उसका वजन भी कम होने लगता है। वहाँ 15-20 दिन बाद या 1 महीने बाद आता है तो बोलता है मेरा 2 किलो वजन कम हुआ। ठीक है, तो कहीं ना कहीं ये जब कॉम्प्रिहेंसिव हिस्ट्री टेकिंग लेते हैं उसके बाद जब हम उसको औषधि देते हैं तो ये बेनिफिट होता है। और हमको क्लिनिकल प्रैक्टिस में ये कोशिश करना चाहिए कि हम ज्यादा से ज्यादा औषधियां खुद बनाएं। ठीक है, क्योंकि चरक चिकित्सा इज द परफेक्ट प्लेटफॉर्म टू लर्न कंपोजिशन मेकिंग। उसमें जो सीक्वेंस दिया है, सीक्वेंशियल दिए, दोष कौन कौन से कुपित होंगे, दोषों की कौन कौन सी अवस्था होगी, जो चिकित्सा स्थान में जो औषधियां दी गई है वो बहुत सीक्वेंशियल दी गई है। और प्रभाव, हम आमतौर पे एक औषधि का प्रभाव की बात करते हैं कि मान लीजिए अर्जुन है, रद्द है, अशोक है, वो स्त्री रोग के लिए काम करता है। अब वेदनाहार महाकषाय की अगर मैं बात करूं तो वेदनाहार महाकषाय में अशोक दिया हुआ, ठीक है, कायफल भी दिया है, सेमल भी दिया है। ठीक है, तो इनके वाइडर यूज होते हैं, प्रभाव के अलावा भी यूज होते हैं। तो इसलिए जब ड्रग कंपोजिशन जब आप बनाएंगे, खुद प्रिपेयर करेंगे, तो आपको उसके प्रभाव, उस कंपोजिशन के प्रभाव के बारे में भी चिंतन करेंगे। जैसे अगर मैं एक एग्जांपल दे रहा हूँ, मुस्तकारिष्ट क्या है, वो हमारे आमाशय और पश्चिमानाशय, पक्वाशय सभी जीआई ट्रैक्ट पे पूरे में अग्नि का कैलिब्रेटर का काम करती है। डोज का ध्यान रखता है, खाने के पहले भी देना है, कहीं जगह खाने के बाद भी देना है, वो स्पेसिफिक है। पर एक मैंने उदाहरण दिया कि मुस्तकारिष्ट एज ए कंपोजिशन वो कैलिब्रेटर है, वो अग्नि बड़ी भी होगी, रुक्षता होगी या स्थिरता होगी, वो कैलिब्रेट करती है पूरे में मुस्तकारिष्ट। Now I will discuss the first case. This is a case of 52-year-old lady with yellow expectoration, very mild dyspnea. पित्तज कांस के लक्षण थे और वो ऑलमोस्ट पित्त प्रकृति थी। उसको बचपन में जॉइंडिस भी मल्टीपल टाइम हुए थे, उसके दांत बिल्कुल पीले थे, पीला ही उसको क्लेश होता था, अम्लोदगार भी रहता था, दाहा रहता, और हमेशा कंप्लेन करती थी कि तिक्तास्थ्यता है। ठीक है, श्वास का जितना भी थोड़ा भी होता था, वो जैसे ही कफ निकल जाता पीत का वर्ण का, उससे उसको रिलीफ हो जाता। तो लगभग 1.5-2 साल ट्रीटमेंट चला। आज के समय में कोई भी दिक्कत नहीं, कुछ उसको जनरल मेजर्स बताए हुए वो उसको फॉलो करती है। वो क्या है अपन बात करते हैं। कि हमने पित्तज कास में देखा था, तिक्तास्थितम स्वरामय तृष्णादाहो श्लेष्मणा पित्त संसष्टम, ये लक्षण उसमें है। अब उसको शुरू में क्या किया, क्योंकि दोष ज्यादा है, आमाशयगत है, तो वमन कराया, क्लासिकल वमन जो हम करते हैं, मदन फल, मधुयष्टि, सेंधा नमक से, मधु से, उसको वमन कराया। उसके बाद रिपीटेडली कुंजल कराया, हर 15 दिन या 21 दिन में उसको कुंजल कराया। 2-3 बार अपने सेटअप पे कराया, फिर उसको बता दिया गया 3 से 4 महीने, 3 महीने तक उसको कुंजल कराया गया। और 3 औषधियों में शफलिंग किया। इन औषधियों के बारे में हमारा, देखिए मैं जो औषधि बता रहा हूँ उसके बारे में चिंतन किसी किसी का थोड़ा अलग भी हो सकता है। सुदर्शन घनवटी, चंद्रकला रस, संशमनीवटी सभी पित्त शमन का काम करती है। जहां उसको रुक्षता अधिक हो रही है वहां चंद्रकला रस दिया है, जहाँ स्निग्धता अधिक है सुदर्शन घनवटी दिए, सब कुछ मॉडरेट है संशमनीवटी दिए। ये वेरिएशन आएगा ट्रीटमेंट में, कभी भी एक सिंगल प्रिस्क्रिप्शन से हम नहीं चल सकते ज्यादा समय तक। So few herbs from कास एंड जोरहर महाकषाय भी है, जैसे मनुक्का, हरड़, आंवला, सारीवा, निशोत। निशोत के बारे में अपन ने रेफरेंस देखा था। तो निशोत बहुत इंपॉर्टेंट है पित्त के लिए, जहाँ भी तनुता रहेगी दोषों की, वहाँ निशोत की आवश्यकता पड़ती है। और मधुर द्रव्यों के साथ, शर्करा के साथ दिया था। ये रेफरेंस भी दिया हुआ है इसमें, कास, हरड़, जोरहर महाकषाय में। पित्ते तनुकासे तीव्रतम मधुरिताम, ये रेफरेंस से इसको हमने डील किया था। अब एक 5-year-old गर्ल, चेस्ट पेन, ग्रॉस डिस्निया, तो डिस्निया ज्यादा था क्योंकि वो 5 साल का बच्चा था और लगभग 3 साल से उसको ये तकलीफ चल रही थी। कंप्लेंट थी लेफ्ट साइडेड चेस्ट पेन, इंक्रीज ऑन वॉकिंग, डिस्निया, ड्राई कफ, वाटरी सलाइवेशन, आम द्रव स्ट्यू, तो कम होता था, मुश्किल से निकलता था ना आम द्रव, माइल्ड कफ, ज्वर बना रहता था थोड़ा सा, आम मल होता था क्योंकि वो एंटीबायोटिक्स का प्रोलॉन्ग यूज था। तो जो भी उसका इंटेस्टिनल फ्लोरा था पूरी तरह से डैमेज था, और मल की कंसिस्टेंसी भी नहीं थी, तो वो दिक्कत थी उसमें, दौर्बल्य बहुत ज्यादा था उसी कारण से। ठीक है, ड्राई हॉट स्किन, स्त्री थी, निमोनाइटिस की स्त्री थी उसको, और माइल्ड प्यूरल रब थे, क्रेपिटेशन था, लेफ्ट साइड में स्वेलिंग भी थी, प्लूरिसी थी उसको, हाइलर कंजेशन था, जो भी उसने एंटीबायोटिक से ली थी तो ब्लड पैरामीटर जो है वो नॉर्मल थे लगभग, WBC ऑलमोस्ट नॉर्मल था, ESR 20-22 के, हीमोग्लोबिन कम था, प्रकृति क्लासिकल कफ पित्तश थी। अब वहां पे हमारा टारगेट क्या था, आम पाचन करना है, उसकी अग्नि बढ़ाना है, कफ का शरण करना है, शोथ दूर करना है। ठीक है, अब हम एक जो सिद्धांत है वो जानते हैं कि अक्तम लवणम तेलेन नाड़ी शंकर प्रस्तर। अब इसके साथ ही हमको ये भी देखना है कि वो बलवान है कि दुर्बल है। ठीक है, ये जो क्लासिफिकेशन दिया है ये क्लिनिकल लेवल पे बहुत काम आता है। तो उसको मृदु स्वेद दिया, सेंधवादी तेल से अभ्यंग किया, मृदु स्वेद दिया। ठीक है, आमतौर पे जब क्रॉनिक इलनेस हो जाती है तो उसमें विराम अवस्था आने लगती है, पर इस केस में उसको आम अभी भी था, एंटीबायोटिक्स का प्रॉब्लम केस था, और चूंकि वमन करा नहीं सकते थे, बच्चा छोटा था, BID डोजेस चालू करा, शटी चूर्ण, पुनर्नवा चूर्ण, विदारी, एलवा, वेदना शमन, महाकषाय का औषधीय एलवा, कायफर, वेदना महाकषाय, संज्ञा स्थापन महाकषाय की एलवा, कायफल, वेदनाहार, पिप्पली चूर्ण, सौंफ चूर्ण, सब अनुलोमन करना, ताम्र, लेखन करना है, नया टिश्यू जहां भी बनाना है और लेखन करना है, दोनों काम ताम्र बहुत अच्छा करता है, यशद भी यही काम करता है, हिंगवाष्टक चूर्ण अनुलोमन, काला नमक अगेन अनुलोमन, धान्यक मिश्री जल के साथ दिया गया, मात्रा अग्नि के अनुसार अल्प मात्रा दी गई, शुरुआत में BID डोज दिया है, क्योंकि छोटा बच्चा रहता है, वो अक्वेंटेड नहीं रहता है, आप जो औषधि दे रहे हैं पहली बार दे रहे हैं, उसको मुहुर देना संभव नहीं रहता है। जब उसके सिम्टम कम हुए, प्लूरिसी सेटल हुई, उसको श्वास लेने में आसानी हुई, लोकलाइज स्वेलिंग दूर हुई, उसके बाद लेटर ऑन सितोप्लादी चूर्ण, सौंफ, कासिस भस्म, रसूट, मल्टीपल डोजेस दिए, द्राक्षावले। आफ्टर रिकवरी उसको लगभग 6 महीने लगे रिकवरी में, उसके बाद 3 साल तक, क्योंकि चाइल्डहुड में जो भी इंजुरी रहती है उसको उसी समय ठीक किया जाता है, अदरवाइज अगर इन्फ्लेमेशन बना रहा लंग पेनकाइमा में तो वो फाइब्रोसिस में जाता है। तो उसको लगभग 3 महीने तक कुमार कल्याण रस दिया गया, और वो भी पुराने गुड़ के साथ दिया गया, क्योंकि वो भी अगेन लेखन करता है, सर्कुलेशन इंप्रूव करता है लोकल। तो कुमार कल्याण रस BID डोज में दिया गया 3 महीने। यहाँ भी चूंकि उसको वात पित्त का प्रिडोमिनेंस था, तो इस बात का ध्यान रखा गया कि बहुत उष्ण औषधि नहीं दे, उसका अनुपान पे विशेष रूप से ध्यान दिया गया। ठीक है, तो हमारे मुख्य रूप से कई बार हमको जब क्लिनिकल प्रैक्टिस में बैठते हैं तो आपको व्याधि को समझने में मुश्किल होती है। हम अगर प्री डिटरमाइंड होकर बैठते हैं तो हमें दिक्कत नहीं जाती है कि हम फिक्स हो जाते हैं कि ये बीमारी है, पर अगर हम प्री डिटरमाइंड होकर नहीं बैठते हैं तो कई बार व्याधि को समझने में दिक्कत जाती है। तो ज्वर से शुरू करना चाहिए, कुछ भी समझना तो कोई ना कोई ज्वर का उदाहरण मिलेगा आपको। ठीक है, तो वातोलवण पित्त मध्य कफहीन सन्निपात ज्वर में भी श्वास एक तीव्र लक्षण के रूप में आता है। तो सामान्य से ज्वर और औषधियों से भी शुरू करते हैं, और वात को हमेशा लक्षित करें, वात को टारगेट करें हमेशा, तो आपको किसी भी रोगी को तुरंत फायदा देने में आसानी होती है। चरक की हर एक संप्राप्ति देखिए, ज्वर से लेके योनि व्यापक तक, सब में संप्राप्ति में शुरुआत में वात की दृष्टि बताओ। चरक संहिता ऐसा लगता है कि वात की कुछ चिकित्सा बताओ। तो 2 फंडामेंटल्स को हम अगर ध्यान रखते हैं तो कहीं ना कहीं, और ऐसा होता है प्रैक्टिस में, कहना आसान रहता है कि आपको कई बार बीमारी समझ में नहीं आती, जब ओपनली हम बैठते हैं तरह तरह के केसेस आते हैं, तो हमें सामान्य सी चिकित्सा शुरुआत में देना चाहिए। अब एक पुलिसमैन, एक मेरे पास बहुत अभी अच्छा केस था, ये रिसेंट केस ही है, उसकी कंप्लेंट थी इवनिंग डिस्निया विथ एक्सट्रीम एयर हंगर। अब चूंकि पुलिस का जॉब ऐसा रहता है कि इरेगुलर लाइफ शेड्यूल रहता है, और वो ब्रोंकोडायलेटर जो भी शेड्यूल रहते हैं वो काफी 30 साल से ले रहा था, ग्रॉस फ्रीजिंग थी उसको, मतलब अगर दूर में बैठा हो तो इतनी आवाज आती थी। उसके अलावा उसको आधमान आटोप की समस्या बहुत थी, क्योंकि लाइफ स्टाइल भी इरेगुलर थी, प्लस वो जो औषधि लेते हैं, जो भी ब्रोंकोडायलेटर सिंपैथेटोमिमिक्स जो लिए जाते हैं, वो ये कॉम्प्लिकेशन करते हैं, सिंपैथेटिक सिस्टम को एग्रावेट करते हैं। प्रकृति वात कफज थी, जो कि तमक श्वास की तरफ ले जाती है। अब मैं इसकी लक्षण पे है, मुझे लगता है हम लोग थोड़ा आगे भी चल रहे हैं, बट आई स्टार्टेड लेट अराउंड 3:30. may take 5-10 minutes more. Dr. Sujata, is it okay to carry on?
Yes, sir.
Okay.
Yes, sir.
Okay, thank you. So हम बहुत डिटेल में नहीं जाते, पर ये जितने भी लक्षण इसमें दिए हैं वो सारे उसमें प्रेजेंट, जो जो मुख्य लक्षण मैंने इसमें हाइलाइटेड है वो सब उसमें मौजूद रहते हैं, ठीक है। और उदावर्त अजीर्णो क्लिन्न काया थी रोधज, ठीक है। अब संतमक कांस के भी उसको लक्षण थे। हमारे पास 2 चैलेंज थे उसको सेटल करने। एक तो उसको डिस्निया बहुत ज्यादा होता था और पुलिस की जॉब ऐसी रहती है कि जहाँ पे कोई मर्सी नहीं होती, आपको कोई ड्यूटी से ज्यादा छुट्टी नहीं मिलती है और ड्यूटी जाने का टाइम होता है, आने का कोई टाइम नहीं होता है वहाँ। और जो भी उसके डाइजेस्टिव कंप्लेंट्स थे उसको भी आपको एलिविएट करना था। मुझे तो सबसे ज्यादा टारगेट मैंने सबसे पहले डाइजेस्टिव कंप्लेंट्स को किया, क्योंकि वी आर एब्डोमिनोथोरेसिक ब्रीदर। इरेगुलर डाइट या स्लीप पैटर्न उसको मैं चेंज नहीं कर सकता था, ड्यूटी आवर्स उसके चेंज नहीं कर सकता था, ठीक है। तो जब भी अगर हम बात की गति को अनुलोम करते हैं तो काफी सारी चीजें सेटल होती हैं, ठीक है। काशीने छर्दनम हृदयात् स्वर भंगे च बुद्धिमान, हमने इस श्लोक के बारे में पढ़ा है और ये दोनों रेफरेंस हम देख चुके हैं। तो लाइन ऑफ ट्रीटमेंट क्या रखा उसका? पिप्पल्यासव कंकासव 15 मिनट बिफोर द मील विथ इक्वल वाटर। दोनों बहुत अच्छे अनुलोम, दोनों श्वासर भी, और क्योंकि वात कफज लक्षण है, प्रकृति भी वही है, बहुत शांत स्वभाव का बंदा, ठीक है। तो उसको किसी प्रकार की इससे उष्णता भी नहीं हुई। 15 मिनट पहले दिया, भूख भी लगी अच्छे से। फिर पिप्पल्यासव कंकासव एट नाइट 20 ml ईच विथ इक्वल वाटर 3 hours आफ्टर द मील। अगेन वात के काल में फिर से दिया 3 घंटे बाद, और उसको तुरंत उससे फायदा हुआ। रैपिड चेंज इन हर आधमा नाटो, स्लीप आने लगी। मैं यहाँ मेंशन करना चाहता हूँ, नींद बहुत आवश्यक है श्वास कास के रोगियों में, ठीक है। श्वास कास के रोगियों के लिए नींद अगर नहीं रहती है तो कहीं ना कहीं उनकी व्याधि बढ़ती जाती है। फॉरेन कंट्री में अस्थमा के पेशेंट को केवल स्लीप सही करके भी सेटल करने का एक नया तरीका निकाला गया है, तो उस पर भी हमको ध्यान देना चाहिए। फिर फर्दर उसको सितोपलादी, हिंगवाष्टक, शटी, कचूर, जीरा, चंद्रशूल, अभ्रकभस्म, शंखभस्म, बीआईडी डोज आफ्टर मील विद द्राक्षावले, जिससे कि अनुलोमन भी हुआ। और जो शटी कचूर है ये न केवल प्रोकाइनेसिस करते हैं बल्कि ये एंटी स्पाज्मोटिक भी है। जरण, चंद्रशूल, ये सारे एंटी स्पाज्मोटिक भी हैं। तो अगर हमारी वायु ठीक होगी, जैसे अगर हम कास की संप्राप्ति पे जाते हैं तो अधो प्रतिघात वायु लिखा है, तो अपान वायु अगर ठीक रहेगी तो डेफिनेटली उदान वायु, प्राण वायु भी ठीक रहेगी। तो इससे तुरंत उसको फायदा हुआ। तीव्र वेग जहां होता है वहां क्या करना चाहिए, क्योंकि कई बार उसको 7 बजे से तीव्र वेग होता था और उस समय वो इनहेलर्स लेते थे, तो उसमें क्षार का उपयोग करना। जैसा कि अभी हमने देखा भी था, क्षार के उपयोग वो कफ के आवरण को, मार्ग कफ के जो अवरोध है उसको दूर करने में मदद करता है। तो सौंफ मुनक्के का काढ़ा बना के काला नमक डाल के क्षार दें, तुरंत फायदा होता है। द्राक्षावले के साथ भी दे सकते, कुटकी डालना चाहिए अगर लवण क्षार के रूप में, ठीक है। और पृष्ठ अभ्यंग करना चाहिए, सहन सदन जो पूरा करें पृष्ठ पे, थोरेक्स एरिया में, एब्डोमेन पे पृष्ठ अभ्यंग ऊपर से नीचे की ओर जब करते हैं तो अनुलोमन बहुत अच्छे से होता है। कर्पूर धारा यूज कर सकते हैं, कई लोग कपूर भी डालते हैं, केले में कपूर लेना कई तरह की बीमारियों में बताते हैं, पर ये बहुत डेंजरस है। इंटेस्टिनल एक्सपेंशन हो जाता है इससे कई बार। एक और बहुत छोटी सी, हमने कहा ना, हम लोग रेफरेंसेस को स्टिक नहीं करना चाहिए। शूल वजनी वटी में भी शटी डला और बहुत ही फायदेमंद है वो, अगर आधमा नाटोक में भी करती है, वेदना में भी काम करती है। तो शूल वजनी वटी भी 2 से 3 गोली एट ए टाइम अगर हम इन्हीं औषधियों के साथ देते हैं तीव्र वेग में, उसको श्वास में बहुत जल्दी फायदा होता है। उदावर्त होने पे हमारे पास ये रेफरेंस है कि हींग आदि का प्रयोग मुझे लगता है थोड़ा जल्दी करना चाहिए। तीव्र वेग में भी कुछ हमने इसी तरह का औषधियां देते हैं। रिपीटेड डोजिंग लेस क्वांटिटी। जब भी मुहुर मुहुर की बात आई है तो वहाँ पे क्वांटिटी कम देना चाहिए। ओवरऑल मेडिसिन दिन भर में ज्यादा नहीं जाना चाहिए, वो इस बात का विशेष रूप से ध्यान रखना चाहिए। जो डेबिलिटेटेड पेशेंट है, अग्नि कम है या बच्चे हैं खासतौर से, उनमें इस बात का ध्यान रखना चाहिए। एक और केस था ये, तब इसमें मेन जो लक्षण आ रहा था वो कॉन्स्टिपेशन आ रहा था, नॉन स्पेसिफिक डिस्निया था, बहुत कम कफ होता था और कॉन्स्टिपेशन मेन था, ड्राइनेस ऑल ओवर, ठीक है, और इंस्पिरेटरी क्रैप्स आते थे थोड़े बहुत, बहुत फाइन। इवन द दूषित वात पित्त उसके शरीर में थी, जो उसका कलर भी डार्क हो चुका था। उसके पेरेंट्स ने बताया था कि शुरू में हुई थी जब अच्छी थी और अभी इसका कलर भी डार्क होने लगा। तो यहाँ पे उसको जो श्वास मिल रही थी वो पित्त अनुगत मिल रही थी, प्रकृति भी वात पित्तज थी। सबसे पहले तो आनाहा को सेटल किया, क्योंकि हमने देखा है कि उसके निदान में भी दिया हुआ है श्वास रोक के और पुरु रूप में भी, तो उसको सबसे पहले सेटल करना था। तो आरगवद अवले 3-4 दिन तक दिया। एलादी बटी क्यों लिखा है? हम लोग जब भी कभी रुक्षता होती है और कोई औषधि देते हैं, चाहे आरगवद मृदु है, फिर भी हमको मृदु औषधि साथ में देना चाहिए जो कि सॉफ्टनर हो। एलादीवटी बहुत अच्छी सॉफ्टनर है इंटेस्टाइन को, या गंधकवटी भी दे सकते हैं जो कि आंतों की वात को कम करती है। आंतों में वात अगर कम रहेगी तो कोई भी औषधि दे रहे हैं परगेटिव, वो आसानी से काम करते हैं। फिर यहाँ पे उसको सितोपलादी राल यशत माक्षिक भस्म दी गई मक्खन घी के साथ। शुरुआत में 5 बार दिया गया 15 दिन तक, फिर कम कम करते चले गए। मैं राल का बताना चाहता हूँ। राल बहुत अच्छा सारक भी है, और जो भी डैमेज होता है कॉन्स्टिपेशन के कारण उसको भी ठीक करता है। तो 3 महीने तक ये दिया गया, बहुत अच्छे फायदे हुए उसको। साथ ही बाद में सौंफ और मुलेठी का चूर्ण घी के साथ और आरगवद अवले के साथ फैकल्टेटिव, जब भी उसको कॉन्स्टिपेशन होता है तो उसको आरगवद अवले, मुलेठी चूर्ण, घी, यही दिया गया। कोई बहुत बड़ी औषधियाँ नहीं दी गई। साथ ही रिफाइंड ऑयल, पैकेट फूड जो बच्चे आजकल बहुत ज्यादा प्रोन रहते हैं, वो चीज उसको अवॉइड करने का बोला। लास्ट केस जो डिस्कशन का हमारा है वो एक पेशेंट है जो कि उसको क्लासिकल सिम्टम आते सुबह 7 बजे, शाम को 7 बजे डिस्निया रहता है। अब वो ब्रोंकोडायलेटर लेते हैं, उसका इसोफेगस भी बहुत नैरो, उसको मेडिसिन कोई टैबलेट ले नहीं पाते, बड़ी मुश्किल से छोटी छोटी गोली ले पाते। मैं थोड़ा जल्दी कर रहा हूँ यहाँ पे। अब ये हम समझते हैं कि कोल्ड ड्राई एयर जो रहती है वो इरिटेट करती है एयरवे को, तो ये भी एक सिम्टम है तम का कारण से। उसको क्या दिया गया? सुबह 4 बजे और शाम को 4 बजे डोजिंग किया गया उसका, जो मेडिसिन देने का टाइम, क्योंकि 7 बजे था तो सुबह 4 बजे वात के काल में, ठीक है। ये रेफरेंस मिलता है ऐसा विषम ज्वर की, जब हम चिकित्सा करते हैं तो विषम ज्वर में वेग आने के पूर्व, वेग आने के समय औषध पान का उल्लेख दिया गया है, ठीक है। तो यहाँ पे भी हमने जो औषधियाँ दी गई, उसके अलावा हमने चूंकि क्षार भी दिया सुबह के सुबह, सौंफ, मनुक्का का काढ़ा, काला नमक, यवक्षार, ये सुबह सुबह दिया गया। द्राक्षावले के साथ दिया गया। पृष्ठ अभ्यंग, कंठ सुधारक वटी, आइदर टाइम, बहुत अच्छी एंटी स्पाज्मोटिक है, ब्रोंकोडायलेटर भी है कंठ सुधारक वटी। अब इसके बाद टीडीएस डोज में सुबह और शाम के तो ये रहे जो अर्ली मॉर्निंग 4 बजे और इवनिंग में था। इसके अलावा टीडीएस डोजेज में जो दिया, शटी काकड़ा सिंगी, जरण, सौंफ, ताम्रबस, लवण, अदरक चूर्ण, आफ्टर मील्स एंड बेड टाइम, ये भी टीडीएस डोज में दिया गया। उसको मुश्किल से 15 दिन में बहुत ही अच्छा रिस्पॉन्स रहा, और वो पेशेंट अब अपने जो उसका नॉर्मल रूटीन, सबसे पहले उसको सुबह के समय बंद हुआ 7 बजे, जो मैनिफेस्टेशन आते थे उसको एक्यूट सिम्टम आते थे, फिर शाम के समय के भी बंद हुआ, अभी वो पूर्ण रूप से स्वस्थ है। अब हमारे पास कुछ चैलेंजेस आते हैं, जैसे रेस्पिरेटरी कंडीशंस आती हैं कई बार, ये उसमें ज्वर भी रहता है, बॉडी एक भी रहता है। इवन कोविड-19 में रेस्पिरेटरी कंडीशन में बहुत सारे कॉम्प्लिकेशंस देखने में आए, किडनी के कॉम्प्लिकेशन, हार्ट के कॉम्प्लिकेशन, लीवर के, स्किन के कॉम्प्लिकेशन। कॉमनली हम जब पेशेंट आता है रेस्पिरेटरी कंडीशंस का सीजनली, तो हमको उसमें ज्वरहर औषधियाँ भी देना पड़ती है, श्वास कांस से रिलेटेड भी देना पड़ता है, लंघन कराना भी पड़ता है, बिहार पे भी ध्यान देना चाहिए। तो कॉमन इंडिविजुअल कुछ अप्रोच रहती है। चंद्रकला रस से लेकर रत्नगिरी रस, जब कफ ज्यादा है सुदर्शन घनवटी, मुस्कारिष्ट, सुदर्शन काढ़ा। इस तरह से श्वास की बात करते थे एलादीवटी, आनंद भैरव रस। अब ये अभी क्योंकि मुझे लगता है वी आर रनिंग आउट ऑफ द टाइम, तो मैं इंडिविजुअली तो नहीं बता पाऊंगा, पर ये सारी औषधियां में से हमको सिलेक्ट करना पड़ता है कौन सा उस समय दोष का प्रिडोमिनेंस है। और इम्पोर्टेंट चीज जो बताना चाहता हूँ कि हमको श्वास के रोगियों में भी पेया आदि का पथ्य का बहुत ज्यादा इम्पोर्टेंस है। और नेति कुंजल प्राणायाम, भ्रामरी, अनुलोम विलोम, ये बहुत जल्दी फायदा देते हैं रेस्पिरेटरी कंडीशन में। अब कुछ चैलेंजेस हमारे पास आते हैं, जब पेशेंट आता है तो ये सारी दवाइयां लेके आता है और उनके कॉम्प्लिकेशन भी लेके आता है, और हमको एकदम से हम बंद भी नहीं कर सकते। अगर बंद करते तो उसके सिम्टम बढ़ सकते हैं। तो इसके लिए हमको कुछ आयुर्वेदिक औषधियां हैं जो कि मेंशन्ड है। चाहे हम उदर्द प्रशमन देखें, कंडुग्न, विषग्न महाकषाय, श्वास काश और महाकषाय की औषधियां, ये सारी एंटी एलर्जिक भी है, मास्ट सेल पे भी काम करती है, इन पे मॉडर्न रिसर्च भी है। तो हमें इनको यूज करना चाहिए और ग्रेजुअली उस मेडिसिन के डोज को कम करके अपनी मेडिसिन पे ज्यादा काम करना चाहिए। तो आई थिंक इट इज ओवर नाउ। थैंक यू सो मच। दिस इज ऑल आई हैव फॉर टुडे and thank you so much for kind listening. So it's over to you, Dr. Sujata.
Okay, thank you, sir. It was very knowledgeable session, and the topic was really very vast, but sir has concluded it within a limited time. So can the coordinator
Hello, ma'am.
hello?
Yes, ma'am.
Okay, over to you, sir.
Yes. Thank you, sir, for your nice lecture. I request Dr. Swati Ugle, ma'am, to conduct question answer session. If there is any question from the listeners.
Hello. Sir, there is no question at all.
Okay.
I think no.
Hello. Hello.
Yes. Yes, sir.
Srivastav, sir.
Yes.
Sir, you were talking about the use of Pathya Kalpana in respiratory diseases.
Yes.
At the end.
Yes.
Sir, can you put some light on that?
Sure.
Yes, sir.
सर क्या होता है, हम लोग जब पेशेंट यूजुअली क्या होता है, जैसे घर में किसी भी तरह का फीवर हुआ, मैं अभी जो बात कर रहा हूँ ये क्रोनिक केस की नहीं बात कर रहा हूँ, एक्यूट केस की बात कर रहा हूँ। तो आमतौर पे अपनी लाइफ स्टाइल को कंटिन्यू रखते हैं पेशेंट, और घर पे अगर वो चाहे तो भी उसको पथ्य देते नहीं कि यार तुम तो खाओ, क्योंकि मॉडर्न डॉक्टर ये बोलते हैं कि आप तो सब खाओ, कोई दिक्कत नहीं है। जैसे मैं आपको उदाहरण देता हूँ, कोविड में बोला गया कि प्रोटीन लो, कई लोगों ने नॉनवेज नहीं खाते तो भी नॉनवेज खाया। ठीक है, हम लोगों ने चूंकि यहाँ पे कार्ड डिस्ट्रीब्यूशन किए, इंडिविजुअल घरों में जाके बताया है लोगों को, तो हमने हमारे यहाँ जो पेया और यूष का जो वर्णन दिया है ना, वो हमने प्रिस्क्राइब किया। और हम यहाँ पे क्या करते हैं कि आमतौर पे पेया बनाना हम बोल जरूर देते हैं कि आप पेया बनाओ या यूष बनाओ, पर आप देखिए जो बना रहा है उस पर कितना आता है, क्योंकि वो खाना ही बना रही है और उस पर्टिकुलर ड्यूरेशन में तो उसके यहाँ कोई मेड भी नहीं आ रही थी। तो हमने क्या बताया कि आप मूंग के दाल का आटा बना लीजिए, चावल का आटा बना लीजिए, ताकि जल्दी बन जाए। सूप बनवाया उसको, और उसको मान लीजिए मूंग की दाल का सूप बनवाया, उसको तड़का लगवा के जब दिया तो 5 से 6 बार दिए। हमने कहा आज 2 दिन तक आप यही लो, तो न केवल रेस्पिरेटरी कंडीशंस में फायदा हुआ, ज्वर तो उसी दिन उतर जाता है उसका, और उसको जो अंगमर्द या सदन मिलता है, जो दौर्बल्य मिलता है, वो दूसरे तीसरे डोज से ठीक हो जाते हैं, क्योंकि अग्नि वृद्धि होती है। और मतलब कोविड के जो सब एक्यूट या मॉडरेट या माइल्ड केस थे उनमें बहुत अच्छा, जहां हम कम्युनिकेशन कर पा रहे थे, हॉस्पिटलाइज नहीं थे, उन केसेस में बहुत अच्छा फायदा मिला। इसी तरह से जब क्रोनिक केस भी आते हैं तो उनमें भी हम लोग यही बताते हैं कि मान लीजिए आप अस्थमेटिक पेशेंट आ रहा है, तो न केवल मील्स बल्कि मील के टाइमिंग पे भी ध्यान देना चाहिए कि कब उसको सिम्टम आ रहा है, उसके थोड़ी देर पहले भोजन दे दे कि उस समय उसको एग्रावेशन ना हो। कई बार जैसे मैंने बताया, एक केस आया था कि 7 बजे होता है, तो हमने उसको खाना भी थोड़ा जल्दी कराया। ठीक है, तो इसी तरह से इसमें जो पथ्य देंगे हम, एक उदाहरण देता हूं मैं आपको नागरमोथा और आंवला जैसे कॉन्स्टिपेशन रहता है, ये मैं बात कर रहा हूँ एक पुलिसमैन के केस की बात करी थी जहाँ उसको आना अदमान रहता है, तो उसमें अभी मुझे रेफरेंस एग्जैक्ट ध्यान नहीं आ रहा, जब हम यवागु बनवाते हैं और उसमें नागरमोथा और आंवला डलवा के, तो इतना मृदु विरेचक काम करता है वो कि उसे मतलब आप पेशेंट का पहले दिन ही रिस्पॉन्स था कि आज मुझे पहली बार मोशन अच्छे से हुआ, जबकि हमने उस पेशेंट में आप देखिएगा कि हमने कोई विरेचन नहीं दिया उसको, केवल नागरमोथा और आंवले का 2-2 ग्राम उसकी खिचड़ी में डलवाया बनते समय। तो इससे अनुलोम होता है, जो भी हमारे दशमूल साधित यवागु का भी वर्णन है, तो जो मूल औषधि का जो रिजल्ट है उसके अलावा कुछ एडिशनल रिस्पॉन्स मिलता है हमको पथ्य कल्पना में। इज इट ओके? हेलो,
थैंक यू वेरी मच सर।
एक चीज मैं और बताना चाहता हूँ कि मान लीजिए जब श्वास कांस के रोगी आते हैं, और वहां पे मैंने एक पेशेंट आपके साथ शेयर किया जिसमें कि उसको रुक्षता बहुत ज्यादा थी, वात पित्त बढ़ा हुआ, वहां पे सिंघाड़े के आटे का इसी तरह से हमने यूज दिया, उसको सिंघाड़े के आटे से सूप बना के दिया, तो न केवल वो बल नहीं रहा बल्कि उसको जो ड्राइनेस थी या जो उसकी वात की दुष्टि थी वो बहुत अच्छे से ठीक हुई। तो पथ्य कल्पना तो मुझे लगता है कि हमेशा ही फायदा करती है।
थैंक यू सर, थैंक यू।
ओके,
थैंक यू वेरी मच सर। Thank you. Now I request to Dr. Vaishali Kuchevar ma'am to give expert opinion on this session.
Thank you, Swati. First of all, I would like to thanks to organizer for giving me this opportunity to chair this session, and I would congratulate Dr. Shirish Srivastav sir for his nice lecture. Actually, it was a very relevant topic in this COVID pandemic, and we all know that respiratory system is a first exposure organ. Respiratory system is a first exposing system which can create many types of disorders. And sir was very vividly explained the shlokas, because we all know these shlokas. The basic knowledge was given by sir, but the main thing was that we don't read the shlokas and don't analyze it, what sir has done. And सर ने ऐसा भी बताया है कि श्लोका से अपन कैसे उसको, how can we implement those shlokas in our practice. That was very important, and sir has also quoted some examples, some cases which I think will be very useful for all of us in our practice. I would like to give some things. I would like to give the crux of sir's presentation. Sir has said that mainly there are the basic principle which we should implement are the hetu, linga and aushad. First, we have to concentrate on hetus. The hetus are very important. Means bahya hetu and abhantar hetu. Means it is not important to diagnose the condition, but it is very important to diagnose the condition, not diagnose the condition, not diagnose the disease. If you are ready or if you are able to diagnose the hetu, bahya hetu like aharaj and viharaj hetu, as well as the internal hetu like which type of dosh involvement is there, which dhatus are involved. So if we all are able to analyze those things, then it is very easy to treat the condition. As sir has said that various mahakashayas are described in Samhita. So it is not important to use only Kasahar and Shwasahar mahakashaya in all types of respiratory condition, but we can use various types of mahakashaya like Vishagna mahakashaya, or sir has said Sangyaharan mahakashaya. So all types of medicines, various very descriptive mahakashayas and all the various herbs are described in Ayurveda. But it is the doctor, it is the duty of ours to use it properly as per the condition of the patient, as per the predominance of dosha of the patient and the agni of the patient. So sir, really a very nice presentation, sir. I congratulate you again, and I would like to emphasize one thing here. As the title of our national conference is evidence-based medicine. or evidence-based Ayurveda. So I think we should publish our all the things which we have done. We know that most of the Ayurveda people are doing very well. Means they are expert in various treating various conditions which are difficult to manage by modern medicine. But the thing is lacking here is we don't publish the things. So it is very important to publish our work. So I would request all the delegates present here as well as all the experts to publish your work, whatever you are doing. And the next thing which I want to clarify here is that there are many things of respiratory system, like specifically that MDR tuberculosis is there, COPD, as sir have said that it's a very burning problem nowadays, as well as bronchial asthma is very important disease where Ayurveda people can do very well. And here the integrated approach is very important. As हमको सबको पता है कि जैसे MDR ट्यूबरक्यूलोसिस में मॉडर्न मेडिसिन में कुछ नहीं है, सो वहां पे इट इज वेरी इंपॉर्टेंट टू integrate, to do the work with modern people, and it is we all are doing for the betterment of society. So it is needed to be a integrated approach. So once again, I would like to thank to organizer for giving me this opportunity. Thank you. Thank you very much.
Thank you, ma'am. Thank you, Vaishali Kuchevar, ma'am, for the expert opinion. And I would like to thank you, Dr. Srivastav sir, for giving such a knowledgeable lecture on such a vast topic in this short period. Thank you very much, sir. I would like to thank Ayurveda Teacher Association whole team, and a special thank to Dr. Chaudhary sir for giving me opportunity to coordinate this session. I would like to thank Dr. Sujata Shamkur ma'am and Dr. Santosh Girubide sir for attending this session as a co-chairperson and giving all of you your valuable time for this session. Thank you, all of you. Now I would like to hand over the session to Dr. Amar and Dr. Sonia ma'am for the next session.
Thank you, Dr. Shri Srivastav sir, for giving very informative knowledge about various respiratory diseases, various mode of treatment, and discussing various related cases. Definitely, it helps in add on our knowledge. I would like to thank Dr. Kuchikar ma'am for giving expert opinion. Thank you, Dr. Sujata Shamkur ma'am and Dr. Girbide sir, and for conducting session very nicely. I like to thank Dr. Nilesh Rajmani sir and Dr. Swati Ugle ma'am. Thank you everyone for giving your valuable time. Over to you, Dr. Amar sir.
We have come to the end of first day of our fourth national seminar at Account 2022. At the end of this first day of the seminar, I thank from the bottom of my heart to all the eminent speakers for lectures full of knowledge and innovative ideas. I thank all the chairperson and co-chairpersons for making every session interactive and fruitful. I thank to all the session coordinators for great coordination of the sessions and making first day of the seminar successful. I thank to Dr. Rahul Suryavanshi sir, Dr. Nitin Chandurkar sir, Dr. Manoj Chaudhary sir, Dr. Anand Madgundi sir, and other dignitaries of Ayurveda Teacher Association for giving us the opportunity and believing us in conduction of the seminar. I, Dr. Amar Kamble, and on behalf of Dr. Sonia Dahat, we are the today's day coordinators, and here I declare that the first day of the seminar is ending here with the discipline and successful conduction more than expected. So thanks one and all, and I am ending today's Zoom meeting here. Thank you all of you for so much patience listening.
Thank you so much. Thank you.
Thank you, Srivastav sir. So we can end here today's Zoom meeting. Sonia madam,
Sir?
I'm ending the today's
Yes,
session.
sir. Yes, sir. Yes, sir. Thank you, sir.
Okay. Okay.
Okay, thank you, sir.
Thank you. Thank you very much. You can leave.